Is the courtroom available?
Yes.
They've got other accommodations actually in the building set up to speak. There's a courtroom downstairs, probate court office, I believe, is that where he's bringing people?
No, probate courtroom.
There's a probate courtroom that they've set up to accommodate what we figured would likely be a large number of people wanting to participate. As it is right now, we've had some employees that are on the agenda for tonight that have left the room just out of concern. So out of respect for what they need to do to be able to conduct business, and some of the employees that do have concerns due to the pandemic, it would be much easier if we could get people to cooperate and spread it out to the two rooms that are, is it two rooms, this room and the room downstairs?
Plus the hallway.
Plus the hallway. It's all TV, it's all connected. As people speak, if they choose to and want to leave, then if you feel more comfortable speaking up here, I'm sure you can come in so that way everybody gets their chance to be heard. But as far as having access to the commissioners, you'll have it downstairs. As far as viewing and hearing, that's all been set up by maintenance. You'll have that downstairs. It's just under the perimeters of the governor's order, they can't start this meeting because it violates everything. And I know that's what you're here to contest, but.
Well, how many people do you have though?
So what are we
Can you
looking
pick some-
at? Is this Mr. Sampson?
Yeah.
Yeah. Are you trying to, so just?
I'm just trying to
Six foot spacing in here right now? Is that-
Yeah, from the looks of it, I got about a half a dozen people. If they were to use the accommodation set up downstairs, we could probably meet what we need to do. So if I get like 6 people to relocate right below where we are.
Maybe remove some of them too, because they're not 6 feet apart.
Right, and
Yeah, but they need to spread out.
yeah,
Yeah.
yeah.
Okay, so why don't we have, why don't we have?
As long as they're spread out too.
Why don't we have people go down to
Stay
the
apart.
meeting room and just come up in smaller groups? and
Well, it's your meeting, I'm just trying to help out because we've already asked.
And we don't want to make it more complicated.
Folks, if you'd be willing, if you are concerned.
camera. Either way, it's streaming downstairs. We're good. So if you just want to aim the camera, so it continues to, I should be doing that. If you just want to continue moving the camera.
Vertical, or is it doing the?
Dave, this isn't my gig, but
Sure.
I would assume if you kind of could go like you there, and then somebody here, that crisscross, I think that would.
Kind of how it was set up when you got here.
So we do like 2, 3, 2, 3.
Yeah, that's why it looked like, from looking at you guys there, like just a half a dozen people could relocate, we could probably make it work. Well, yeah, I was sitting there, I said there like a couple.
So I'll leave you. I'll go back there.
Listen, I'm just trying to make it work, you know what I'm saying?
Because you don't have to touch anything. Yeah. Just whatever you see here is what's being brought downstairs. Yeah. So good. So when you pay attention, that you see more in this video than you do there. Commissioners, just realize when you get to the point where you ask the public for comments, there's about 20-second delay from here to downstairs because it's the way it routes. You have to wait that time. At that point, Chris will make your phone ring, and that'll be him downstairs giving the opportunity to the public to speak.
Dave, if we get going and I'm going too fast, I want you to wait.
Sure, I'm gonna make my rounds and make sure everything's working good.
Will we be able to see them as well?
No, but you'll be able to hear them through your speakerphone. But don't pick up the handset because then only you will hear. Just hit the button to pick up. Okay.
Thanks, Dave. Okay. It is February 3rd, 2021, and this is the meeting of the Andrews County Commissioners. And let's stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. It is 5:20. All commissioners are present. I entertain a motion to accept and approve a waiver of the reading of the minutes from the January 20th meeting.
I make a motion to approve the minutes for the meeting dated January 20th, 2021.
I'll second.
Madam Chair, I request the minutes be changed. It says FOIA, F-O-I-A, it's the federal act, not FOA, F-O-O-A, which is the main act. Thank you. Other than that, I approve.
Okay, all in favor? Opposed? 7-0. A motion for approval of all warrants.
So moved.
Okay, and that is warrant 2067, 2069, 2070.
2102, 2119, and payroll warrants.
And can we, let's go ahead and take the
Oh, and
questions.
corrections
with that.
warrants 2112, 21, 21.
Thank you, Commissioner Kelly. Second to that?
Second, Roland,
Okay,
Roland second.
all right.
Sorry,
And any discussion on the warrants? Okay, all in favor? Opposed? Okay, Maine County Commissioners Association meeting, was there a meeting? Commissioner DeBoer?
Chair, there was not a meeting, and there was also not a policy meeting, but the lobbyists did send out a information brief about certain laws, proposed laws that or bills, should I say, that legislators have put forward, but that is it. But if I may, I would suggest that we talk about what everyone is here for, so we can resolve that sooner, but that's just a suggestion.
It would take a 5-vote count, I believe, to change the agenda. Are you making that motion?
Sure, I'll make that motion to move up new business D to now.
Okay. Is there a second to that?
I'll second, I'll second that.
It- it-
It's a
yeah.
discussion item, so
Okay.
we can debate it. I'll second that. What's the purpose of doing that? Does that help the district?
I just see there's a lot of people here, and it seems like that's why they're here, so that's why I want to move it forward.
Any discussion?
Chair,
Yes.
I would respectfully request that we actually stick to the agenda. The COVID protocols, section D, or section C, or under new business, directly affects the public as well, in the case that it says that public will be required to wear a mask when in public areas in the county building. So if anything, I would suggest that we actually wait on that or front load both of those, because this encapsulates much of what these folks, at least I presume these folks are here for. Both policies will be of concern to the public, as are all policies with these especially. Thank you.
Madam Chair, if the commissioner doesn't want to take the item out of order, I'll vote against the motion.
Any other comments? Okay, to make sure everyone is clear, what we're voting on is changing the agenda to bring item 8D up to take up now as opposed to where it sits on the agenda. All those in favor? Opposed? Thank you. Central Maine Workforce Board, Madam Kelly?
I have nothing at this time.
Administrators report.
Just very quickly, we're working on the 2021 final budget book that will be going to municipalities, commissioners, and department heads. That should be ready sometime next week. There are new regulations regarding several jail standards. Among several other things, contact visits will now be required, which will make the purchase of the body scanner more imperative. We are reviewing the product and the process, and we will be moving forward shortly with that. Bids have gone out for one sheriff department vehicle and for ammunition, and we'll bring out those bids to commissioners for approval. Commissioner Michael and I had a meeting, a Zoom meeting with Mr. Glessner, State Court Administrator, regarding his letter on accounting and state practices for COVID. And you have a memo regarding that. Things went very well. The audit is ongoing, as is the EMA renovation. It was requested that we hold a workshop after the next meeting regarding the bond issue for courthouse renovation and upgrades, and we will make that happen. The sheriff and I have been having a conversation about the courthouse renovation and the news interest. The sheriff can further explain, and I'll turn the rest of my time over to him.
Is that okay with you guys?
Yes.
Okay. In the interest of time, I'll try and be brief. Long story short, I was a little concerned when I looked at things moving forward and looked at how we would handle things from jail experiences. So I spoke to a reporter who had an interest in doing a little bit of history about the building, as well as he had heard things about the condition of the basement that the sheriff's office is located out of. So I offered to give him a tour of the facilities, and he, 2 birds, 1 stone. Article of interest, as well as looking at the basement downstairs. I'm glad I got the chance to speak with you, only to warn you that when the article appears, I don't believe it's going to be flattering. I know some of you have toured the facility downstairs several times. I know some of you, when you first got elected, some of you might not have had the chance yet due to COVID issues or your own health concerns. But we looked at it, as well as the old jail, pretty extensively. And when you look through more than just what the deputies are occupying for space and CID works out of, when you're looking at conditions of a facility, it gives you an entirely different outlook. So some of the things we observed were very concerning. Some of the conclusions were concerned. I think it's a good idea, as Larry had said, and I talked to Larry a little bit about it, of having workshops regarding the space. Because after really thinking of it all and how it all came about on the inclusion of our end, and I did point out to the reporter, there was some very important things for the county building perspective in this bond package you're looking at, specifically the mechanics, the heating and all that things. As far as the basement goes, I think we need to have a discussion, because I know in the past when a commissioner had asked me, it's the people's building, it's a government building. So there is some sort of standards that should go by. But when you're looking at that basement, I wouldn't want you to spend $1.5 million for our purposes, knowing it won't meet the need. And the idea of repurposing it, where maybe the best investment would be to turn it back into a basement. But that would be for a bigger discussion. Going through, we discovered the night before there was mold on a wall in a room. That seems to be a reoccurring problem. It was pointed out to us by staff on Sunday night. We advised maintenance the next day, as well as requested air quality testing. So that will be in there. The tour was done last Tuesday. We've shut the room, so it's not for use, but we've had other mold issues in the basement, different offices. So where it's a reoccurring problem as a basement, and there's been things done that aren't conducive to a basement or are conducive to growing mold, like adding more walls, interfering with airflow, light, things of that nature. But I wanted to give you the heads up because I believe this is 30 years or more of neglect to an area that I actually question if we should ever been located in, to the extent we are. The idea would be, as Larry's suggesting, that we meet and workshop to say, how do we move forward? So while you read it, it might be a shocker. It might not. I don't know what will end up being printed. We're part of fixing it moving forward, because I just think the can's been kicked down the road far too long when it comes to the conditions down there. Not to mention maybe the lack of square foot for the size of the organization we're in. Don't want to take up too much more of your time. That's about all I can say with giving you the vanilla, what my impression was of the tour. The tour wasn't of the county building. It was just of our area. So I don't want you to think that, hey, let's go for a walk here. We did the old jail. We did the area where we were coming out of. I threw at him some ideas as far as repurposing, much like when we redid dispatch, I had a concern with, will this work long-term, because there was an investment there. But it was discussed we could repurpose that room. Now you could repurpose it for maybe people waiting for probate issues. I don't know. But I think we need to look at a long-term plan rather than just investing in an area that might not be feasible for us or maybe worthwhile for the county to invest that kind of money in. Again, just my impressions. I'd be happy to talk with you again later, but I didn't want you to open up this article and say, where did this come from? And again, I don't think it's any fault of us, I just think it's 30 years of occupying a basement, and should we have been there, and there's never been a serious renovation proposal till now, so.
Thank you, I appreciate that.
I'll stop the question. Where are we at with the vehicle orders? Have you set everything up?
We were, got last year's vehicles and the vehicle year before from August on. As Larry just stated, we went out to bid for one vehicle last week, and we requested the next 4, which will round out this year's purchase. So we've got everything we've ordered and purchased over the past few years. We're up to date right now.
Cool. Thank you.
That makes sense.
Yeah, that makes sense.
Yes, Commissioner Medora.
Yes, thank you. I got a couple of things. One of them is, Larry, well, I'm sure either one of you could talk about it, is you said that in-person visitations are gonna be required. What preceded the requirement?
The mandatory standards. What preceded it, or why are we at it? Before it was in-person visits. And went through the legislative process, and ironically, there was a number of things that went through the legislative process and failed, but now have become mandatory standards, which are being challenged. But as you're aware, in other situations with the current administration and the Department of the Commissioner of Corrections, this is how things are done. So this was challenged at a legislative hearing, but if you read the notes, they heard all the concerns and just moved forward. I don't know if the Sheriff's Association will be moving on to the next step, but it's ironic that there's a few things that went through the legislative process last year, failed, and they've still become mandatory standards, but that's where it's at.
Yeah, personally, I do believe, I see a lot of good of in-person visitation, but clearly with technology.
And we are offering in-person visit. I know it's been
Yes.
reduced. This is actually contact visit they're calling for.
Okay. So another thing is, one thing that I haven't heard discussed yet about the jail is where in line our inmates are for getting the COVID vaccine. I think any person that was a fiscal conservative can realize that one hospitalization is gonna cost us a minimum of $10,000. So, congregate care setting, people with health conditions, where are they? And also, where are our staff in line for this right now?
On the public safety side of the building, everybody's had their first series that has wanted it. The second series is scheduled for mid-February. On the correction side, how the rollout went, I believe they're getting their first series next Thursday, next Wednesday.
Have you made any initiatives to try to get vaccines for our inmates?
We were advised by the governor's office that, like everybody else was through those 2:00 briefings, that there was no plan for that yet, I believe, and she thought that maybe the correction staff would serve as dual purpose. So we have not heard, much like I haven't heard when my mother will be able to get the vaccine. Not to sound, I can't give you the answer is what I'm saying.
I think that there's, while I see that there are a lot of people in the community that have not had an opportunity to get it, everybody, for the most part, there are really compelling and financial compelling reasons for why the inmates should receive the vaccine ahead of many people. Our primary role is their health and safety, and while it seems a little peculiar to put them among other people, it's partly about the bottom line of the county and our statutory requirement for health and safety. So I would encourage you to see if we can press the issue and make it happen, because there are a lot of compelling reasons for why we should.
Thank you. Sheriff, I want to ask a question. I believe I know, but is there under consideration from yourself or from the governor's office a requirement to make all inmates receive a vaccination? Would you consider that if it was handed down to you?
If they make it available to, I wouldn't force anybody to take an employee or inmate, nor do I believe I have the authority to. If it was made available, I would provide it to them. Is that?
In the sense that they would not be coerced or receive any
No, we would
different
basically
treatment
put out
if they
that
did
the
not get a
vaccine is
vaccine.
available to you if you'd like. The only concern we have, because we discussed it today actually, when you're vaccinating the inmate population, you have to keep track of the second dose, otherwise you're wasting doses.
Yeah.
So as you know, we're classified short term, you know, and it's hard to prioritize when you have a head count of 125 and maybe get 15 doses.
Yeah.
Who gets it? I think those things would be factored into this decision, as well as working with our medical department to see who's highest risk. Because we do have high risk people due to medical conditions where you'd want to, but the only concern we would have when you roll out to the inmate population is who's here today doesn't necessarily mean, you know, who's here in 2 weeks when the second dose comes in.
And in that vein, what is the current pretrial population percentage? I realize you're not.
I can't give you a percentage, but I can give you the number. There's 104 pretrial and 22 sentence last I looked sometime this afternoon.
So I would just like to respectfully state, and I appreciate the fact that you're trying to respect people's freedoms. If people are pre-trial, and if a move, not necessarily by you, but if there is a move being taken to force them to take a vaccine, that even violates due process if they're being forced by the government to do something without even having been convicted, and that isn't even their punishment.
Just to let you know for your own,
Yes, sir.
for your own good, I guess. Every meeting I've participated in, whether it's Maine Sheriff's Association, Department of Public Safety, on Fridays, or, you know, there's a number of Zoom meetings that you follow, and there's the reverse end of this. But what has been made perfectly clear to us, there isn't any efforts in any way to require state employees or the inmate population on that note. Because it's been asked, required, as far as individual agencies across the state, I don't know, but, you know, basically, if the state isn't requiring it, it can't be labored down, I would believe, in the progression to say, we're requiring, you need to require it. So there isn't that kind of movement that I've seen, and it would be concerning. You know, it's offered to all of our staff, not all of them took it. It's offered to all correctional staff, you know, next week, the ones that wanted it will have it. We've been working with other agencies, when they have a dose or two left over, they call and say, we have somebody you wanna send over with us, and we do that. When it comes to the inmates, that'll be another thing. When we tested the inmates there months ago, to see if they had the COVID test, we didn't require anybody to take it. The only time we required testing, we had to by CDC and DOC guidelines, is when we had the outbreak, we were required to test all staff. And we did that then.
And I would just point out, we've had not a criticism of you, but we've discussed this about the pretrial population has been an issue, I think, for all 4 years of my commissionership in the past. So it's not one administration or another, but it is a grave concern that if, and my grave concern is that the governor will now hand down another mandate, which is part of why I believe people are here and why I'm supporting this resolution, is to make sure that people are actually having their say before that happens. Because in truth, in respectfully, you requiring people to leave this room, not to criticize, but you requiring these people to leave this room per her mandate, whether you agree with it or not, would then also by rights require you to require any inmate to receive a vaccine, whether that was right or not. That's my great concern. So I respect your office, I just want to highlight that's my concern. She could very easily mandate whatever she wants, and that's why this resolution is important later. Thank you.
We're sort of debating hypotheticals,
I'd like
and we
to-
have to think the point here.
About the building, but right before that, you know, we can't force people to eat food. In the gym, we can't force people to eat food, so I don't really see how the governor's gonna force them to get a jab in the arm when we can't even get them to you know, eat life-sustaining food. We have to go to court for it, so I don't really see that as based in reality. But right now, we're just dealing with that we, you know, there are compelling reasons to give these people vaccines, and that's what I'm concerned about. But thank you, Sheriff, for coming today and talking to us. And I appreciate you working with, I presume it's Christopher Williams, or some Sun-Journal reporter about the building.
It was Mark Lafond, I believe.
Okay.
And it was just, I think that the public doesn't know. And
Exactly.
the first phase of this was to raise awareness and, you know, to let everybody know what's going on. And just to let you know, the truth is what it is. I'm not afraid of you know, the honesty of it all, so, but again, I was worried how it would come across to the commissioners. Want to fair warn you, you know, it's 30 years of an old building, maybe 100 years of, you know, neglect, so just, you know, here's your fair warning. At the same time, when it was completed, I did offer to give him a tour of the jail, because I think that would be an interesting perspective too. There's been changes there since that's built. So that way people can have an awareness of county government, of the facilities, of you know, just things that may be of interest. Not afraid of the truth, you know, and there's, especially with law enforcement nowadays, there's a lot of concern going out there of what's happening. So I thought it would be a good opportunity on that level as well. You guys all set? I look forward to talking more about it in the workshop sometime.
And administrators, does that
I'm done.
include your
Yes.
report? Okay, we're on to the section of comments from the public. I know we have not taken up the issues that I am assuming some of you have come to discuss, but.
I'll step around, just wait for the phone.
Oh,
I'm not sure if I took up your Dr. Sturm or not. Madam Chair,
yes,
will the public be commenting on the resolution this time?
you know, comments from the public. If you have a motion, if you have a suggestion of how we should, I
Well,
would be willing to listen.
Well, you could, comments from the public could be on any subject, of course.
Of course.
And then you could also allow comments from the public after the item is introduced and recommended to the commission. You can do anything you want.
Or you could wait on that particular issue to just that, under 8D, you could, any comments, you can.
Wait for that.
Is there any disagreement with taking that course? Yes.
No disagreement, my only concern is that I want to avoid, much of a back and forth. I don't think that would be particularly helpful.
Right, comments from the public need to be that, we're not here to debate them or to critique their comments. We're here to show them respect and let them have their voice heard.
For efficiency's sake, will we have a time limit for those comments?
And I believe our bylaws set up, what is it, 5? Supposed to vote?
Off the top of my head,
You know what, I can look it up while we're doing something else, I've got it in my notebook. All right, Mr. Michaels, well, let's stop, is there anyone from the public that would like to comment now as opposed to waiting? For continuing issues?
She's just asking if you wanna do comments now, so we'll
Anyone in one of the other rooms that you'd like to comment now as opposed to waiting until a particular issue? Okay.
I believe he was asking, Dave.
Can I ask one question? Whether any of you are, I was going to ask Mr. Sampson, but whether any of you are aware if the inmates are required to have any other checks? Like
Yeah, hold on a minute.
Well, quiet.
No, they're not.
He's answered that question in our meetings before, that we legally cannot require them to take medications, to take shots. You know, it's like any citizen can refuse medical care. So that's a great question.
He's got your TV down there.
Yeah.
Stupid.
So there are people that would like to speak now.
Chris, you there?
Yeah, I'm here.
Turn the volume down on the TV. How you doing, Chris?
Wonderful, how are you? Is this full cash? No, we're not sending meetings.
I'll check to be sure. Oh, actually.
Hey, Dave? Dave,
Yes.
the channel changed and now it won't go back. Do you have a remote?
It's not my office. Do the input buttons.
Yes. I have a meeting.
So let's change gears. If they would like to speak, have them, just have them send them up. And
They can just give them the phone, they can talk. While they're doing that, I'll go fix the TV.
Okay, we'll move on. We'll come back to that.
Madam Chair, I respectfully request we allow people to come on here. This is part of the whole reason why this resolution is so important and this question is so important.
Have them come up. We had a time at the elderly, so to the elevator, and we'll move on to Okay, we're going to sort of change gears here. Our building manager is gonna help me with, as people want to speak, bring them up in small groups up the elevator, and then they can speak here in this room. And I think we'll be able to understand them better anyway, so it's probably a better plan all around. So we're going to come back to that by necessity. Bylaws change. Commissioner Michaels, this was something you were introducing, so I'll let you change. I think are we on the third reading? I know it says first reading here, but I think we're like second or third, aren't we?
We're in the second meeting. The first one was just the introduction. This is the first vote, and then there'll be one vote after that.
Do I ask you that every meeting?
Yes, you do.
Yes, I did.
This is the first of the last two, we think. Depending on how it goes as well. This is a change in the bylaws, which aligns the bylaws with the county charter. County charter requires the commission to meet at least once a month at a regular meeting. The bylaws, for some reason, changed to require 2 meetings. There are some times when there's not need for a second meeting, and there are also times when the board meets several weeks in a row, such as around budget time. So this would remove the requirement that we meet twice a month and allow the board and its intelligence to determine how many meetings we need to have, as long as we have at least once. There's no interest that I've seen for the board members to change to one regular meeting a month. But there may be an occasion when we would skip one meeting some months possibly. That would be at our discretion.
And no action needs to be taken on that. We're just going through the process of the.
No, the first vote is on that.
Did not know. Okay, so the first vote is tonight?
Yes.
Okay, I've got my notes all. Okay, a motion to accept the bylaws change.
So move.
Second. And all of those in favor?
Madam Chair.
Discussion.
Okay, it's been discussed and vetted quite extensively, but as long as it's not, if it's new material.
This is the time for the discussion for the bylaws. I think it's critical, especially during this time, that the commission continue to meet twice a month. The legislature is not in session, the legislature has not been in session for 9 months. We've actually helped our own constituents and others who have not been able to have their voice heard by actually being in attendance twice a month. And given our salary, I feel it's ample compensation for us to spend that time and be here twice a month. If a meeting has a light agenda, we are able to move through things quite quickly. But however, I feel that we have an obligation to be here twice a month so that we are serving our constituents as best as possible. Thank you.
Okay, thank you. And our schedule has been voted on and set, and it is for twice a month. It's just having the bylaws match the, go ahead, Commissioner.
No, that was it. I was just
Oh,
gonna say, we
well,
are
go ahead, you
still
say it then. I'll be
month.
quiet, you say it.
I mean, we're not changing the meeting. I've got no interest in changing the meeting. not gonna meet twice a month. I think it's more for technicalities if a meeting falls on.
The one meeting that, the 1 month that you generally don't meet twice is that in the past, except the last couple of years, you have not met on 4th of July week.
Yeah, and again, we already voted on the schedule of meeting twice a month for the entire year.
And I was going to echo the same sentiment, there's no, inclination that we have to start meeting twice a month. It's just making the, bylaws match the charter.
Madam Chair. I would just point out that, if we're not intending to do it, why are we changing it right now? And if we're that gravely concerned over the July 4th weekend, we can always just change the bylaw for that purpose only. Once we dial that back to 1 meeting a month, I can almost guarantee in the future, though I cannot speak for the commission, that it will become once a month next year. And I do not feel it's appropriate for us.
Any other comments? Yes, sir.
Just a correction, Maine legislature is in session, so the schedule is available online.
Thank you.
Point of order, have they had their first legislative day? Because my own legislator told me they have still not had their first legislative day. Thank you.
Yes, sir.
I see no reason not to empower the board to make decisions on its own. And regarding the need for the all-powerful commission to be in session to offset the terrible things that the legislature might do, I remind the good commissioner that when he decided, and enough of us agreed that there was an emergency, a couple of days after we had just had a meeting, we called an emergency meeting. I was the chair at the time. I called an emergency meeting at Joe Becken, and we handled a subject that kind of may have helped. So we can call an emergency meeting anytime, and I doubt there'll be much resistance, and certainly not if there's votes on the board that are of interest in doing something at that meeting. So the idea of having to be in session, just in case we can respond to something bad that the legislature doesn't bring it.
Madam Chair, I respectfully disagree. I understand what you're saying, but there was also a question called into whether that resolution was legit because of public notice concerns, et cetera. And also, as an oversight role, we should be around to hear whether that's from our constituents or whether that's from staff or others. Thank you.
Yes, sir.
Hi, I am, thank you, Chair, I'm not particularly keen on it, and I definitely see the argument for, us being able to decide our schedule. But it's, it's not because I think that we should be talking about things that we don't have the power to change. I think talking about things that we really are not in our domain is really not a very good use of time, but I do feel like 2 meetings a month is perfectly, is sufficient, and I'm afraid that if future commissions were to deviate from that the focus that needs to be done on county business may not be done if future commissions adhere to 1 meeting. Of course, I can change it too. Thank you.
All right, if there's no other
Madam
comments.
Chair, parliamentary inquiry, how many votes will it take for this first vote to be valid?
Takes 5.
Thank you, Madam Chair.
Okay, all those in favor? And those opposed? Great. All right, moving on to the 2021 tax commitment, and I'm going to turn that over to the administrator.
Okay, you have that in your packet. The total tax commitment comes in this year at $10,816,380 for the year 2021. That is based, the mill rate goes from 0.00125 last year to 0.00120 this year. Or in plain English, $1.25 a thousand down to $1.20 per thousand. And so that is a decrease in our tax rate. And so the request is in front of you there of a sum of $10,816,380. And the one thing that you need to to vote on that we left blank because we had it in last year and you changed it, and that is a percent of interest commencing November 1st for any of those municipalities that have not paid. Then last year, the maximum was 7%, this year the maximum amount that we can charge is 6%. So you need to, accept the tax commitment, and B, determine the amount of interest.
Okay, let's take these issues separately. So if everyone look over that, I mean, we've worked on the budget for months and months, I'm sure you're very familiar with these numbers. And the budget, of course, has already been voted on and decided on. This is just a statutory additional step that we need to take. Commissioner Medora?
Thank you, Chair. My suggestion is that we tackle the interest question first, because it should be a commitment when we sign it.
Okay.
And while I understand the max rate is 6%, I think 4% would be pretty reasonable. But you know, we only really have one town pay us late, so I don't know if we actually even charge them interest. But that would be my suggestion. So I'm looking to make a motion to make the interest rate 4%, commencing November 1st, 2021.
And you're making that a motion?
Yes.
Okay.
I'll second that.
Recommended to 1.5%.
Is there a second to Commissioner Larry's proposal of 1.5?
Would that be an amendment to the current motion B?
Well,
I mentioned amendment, I'm sure.
the original motion was 4%. He is asking to amend it to 1.5. I don't have seconds on
I'll
that yet.
second.
Okay. All right, this discussion.
Madam Chair,
Yes, sir?
so what kind of feedback have we had over the years on the towns, if they do fall behind? What kind of hardship is involved? Can anyone assess the current condition now, the finances of the town? Is there a reason why we might want to go with a lower number out of the one that Commissioner Medora and I was suggesting?
It's a very new policy we put in place 2 years ago, I think, and then the first year we had it in place because of the bond markets drying up and towns struggling. We decided last year this would not be a good time to start that policy, and we let it go. Is that your recollection?
We have, throughout the years, been authorized to charge, for the last 7, 8 years, has been 7%. And we, for a number of years, did not charge any interest. And then, I think it was 2 years ago, or possibly last year, we began charging some interest. But in essence, what happens is, let's say none of the towns pay, we're running over 11 months of our budget with no money to operate with. And so every municipality that neglects that, and again, there was only one this year, but you know, it doesn't take much for our tax anticipation notes to really begin to hurt.
Commissioner Bedell?
Yeah, the reason I suggested 4, to some extent, I don't think it clearly it's not very consequential, but we do need some sort of incentive to have them pay beyond their obligation. I haven't really heard many times with that sort of hardship. You know, there hasn't been a tremendous amount of uncollectible tax payments out there in our municipalities. But I think 1.5 might be a little low for an incentive. So, but I didn't want to go with the whole 6 because, you know, it's all taxpayer money, and we don't wanna be vindictive or anything, so that's why I suggested 4.
Any other discussion?
Madam Chair, I would request, inquire of Mr. Post what last year's percentage was.
Right off the top of my head, it was, I think I'm right, it was 3%.
Madam Chair, I amend my motion to 3.
Okay, so we have a third amendment, you're amending your.
I withdraw my previous amendment, just for sake of time, and move 3% instead.
And you have the second
I
on
do.
that,
I'll second that as well.
the 3?
Madam Chair, I respectfully call the question, in the interest of time.
All those in favor of amending the percentage on unpaid balances to 3%? Opposed? Okay, on to the actual, tax commitment. And Mr. Post, is this something by law that has to be read into the record or just voted on?
It can be just voted on. Or you really need to put the total amount of the dollars,
Okay,
in the motion.
all right. So the total amount of, yes,
Chair, I'd like to make a motion to approve the commitment as presented. That is to raise a tax levy of $10,816,380 even. And that would be for the year 2021, due on November 1st, 2021.
I second that motion.
Actually, it's due September 1st, but interest doesn't start till November 1st.
Why would we do that?
It's in statute.
So let me correct that, due September 1st.
Seconded. Okay. All in favor of adopting this tax commitment? Opposed?
4, sorry. Given that it's lower than it was last year.
Okay, very good. All right, the next issue is one that we've been discussing for several weeks. And just to recap on this, we were addressing some employee issues. We've been discussing a protocol. After we discussed it on January 6th and the 20th, the motion was then by Commissioner Ames to refer it to the Safety Committee. I was not expecting a report back already, but they got right to work, sent a report back. And I would entertain a motion to call the question, seeing how this has been discussed in great detail for several weeks. We've had the proposal in front of us. Voting now would not be the vote. Now, if there's a motion to call it the motion, we would not be actually voting on the protocols, but if we want to call the motion, or if we want to go back and discuss it further.
Madam Chair, what is the purpose of that?
Because we have spent so much time discussing it, and we would just be rehashing old material. And it's up to the board, it's certainly up to the board, we can go back and discuss it further, or if there's a motion to call the question, we can do that, it's up to you.
Point of order, Madam Chair, this is
Actually, Commissioner O'Leary,
Point of order, Madam Chair.
Commissioner Poyer had his hand up
Point
first.
of order, Madam Chair.
Commissioner Poyer?
Motion to, call. Recall it, I'm not sure exactly how you want to word it, but I apologize.
Call the question.
Call the question.
Point of order, Madam Chair. The bylaws permit a point of order to be raised and to interrupt, which I'm not doing, to call, either to correct a mistake, and this policy was not what we received before. This has changes, especially the mask requirement for all public people that come here. So I would respectfully disagree with your statement that this has all been rehashed. Thank you.
Chair, I'd like to second Commissioner Rowland's motion to approve the protocol as written.
Yeah, well, we need to back up a little bit. We're only discussing if we're going to call the motion. If that's voted down, then of course we'll go back and discuss the protocols. So his motion was to call the question. If we have not been discussing it at this meeting, because I actually looked this up ahead of time, we actually have to take a vote on if the commission wants to call the question.
Okay.
It's a little bit redundant, I
I
know,
understand.
but we'll try to do this as,
Voting on whether or not we wanna take action tonight, is that what you're saying?
if you want to take action without debating it and rely on the debate that we've had in the last two meetings. Yes, sir.
I'd like to move the table to the next meeting, so we can have the actual safety committee in here and talk to us about it.
Okay. Is there a second to that?
Second.
All in favor of tabling this to the next meeting when the safety, we can have the safety committee and discuss it?
But it's not the resolution.
Or opposed?
I wouldn't do that to you.
Madam Chair, I'm opposed, and I respectfully request the minutes reflect this
Well,
has not
actually,
been
you can't
discussed.
you can't make a comment on a table, only on a no vote.
I do not see that in the bylaws, Madam Chair.
You can make your comment at the commissioners, when something is tabled that ends all discussion.
That ends
But I
discussion, I'm voting
certainly
no
can't
and
make a comment
stating that
after
I'm
the
opposed
commissioner's
to this
comments.
based
Okay, we're
on
going to
that.
move on to the next issue.
Madam Chair, I respectfully object.
The mandate resolution, Commissioner Leary. And I would entertain a motion to discuss item D on 8, new business mandate resolution.
Madam Chair, I make a motion to discuss the mandate resolution, item B under new business.
I'll second for discussion.
Madam Chair, with the permission, I'll introduce the reasoning behind this motion, or this resolution. Thank you, Madam Chair. The United States of America has always been a unique place because it was governed of, for, and by the people. New laws had to undergo extensive debate and scrutiny as they worked their way through the legislative process, through committees, through both houses of the legislature, whether that be state or federal, possibly having a veto by the executive branch, possibly overriding that veto, giving the public ample opportunity to speak out publicly, peacefully, and effectively their concerns about laws that would govern their lives and affect their lives in many different ways. The law and the legislative power was put into the legislature, the ability to make laws, and it was made in a difficult process so that people had time to respond and were able to have their concerns aired. But all of that changed last March. Governor Mills declared a state of emergency and proceeded to issue executive orders that directly impacted the lives of Maine citizens. But this time, there was no scrutiny, no discussion, not even a hearing, where people that would be affected could have shared their feelings on this issue. As you have seen yourselves today, with all due respect to the requirement or request by law enforcement for you to spread out, that was part of the governor's mandate, not a law, but a mandate. So your freedoms can be infringed upon, and a meeting could even be prevented from being held. And then where are you to actually make your protest? Since March, Governor Mills has issued a pandemic of executive orders. Of particular concern are her mask mandate orders requiring all Mainers to wear masks, regardless of social distancing, in ridiculous locations, such as parking lots or an outdoor transfer station. According to Pierce Atwood, a well-respected law firm, quote, thus the December 11 EO executive order contained an internal inconsistency whereby it simultaneously exempted individuals with certain medical conditions from the face covering requirement while also prohibiting accommodations that would allow such persons to enter or remain in public settings without a face covering. In addition, the press release announcing the December 11th EO characterized the EO executive order, as clarifying that claiming a medical exemption is not an excuse to enter or remain in an establishment without a face covering. With the stroke of a pen, without public comment or legislative scrutiny, the governor changed the lives of every Maine citizen. And not a subtle change, but in a way that keeps the pandemic on the forefront of everyone's minds, and it promotes an atmosphere of fear and groundless submission. A mask on every face, required under penalty of heavy fines or jail time. And the underlying supposition is that we must all sacrifice any and all of our freedoms that the governor or any executive branch demands. If we oppose, we are selfish. This is a radical new perspective in America, and one fundamentally at odds with foundational principles and individual freedoms. Sadly, sickness is not new. I grieve when anyone passes away for whatever reason. But coronaviruses are not new. Do masks really help? Virus particles are so small that they can easily penetrate cloth masks. According to the American Association of Physicians and Surgeons peer-reviewed article, a human hair is about 150 micrometers thick. The COVID-19 particle or virus is 0.125 micrometers. Surgical masks, quote, surgical masks are loose-fitting devices that were designed to be worn by medical personnel to protect accidental contamination of patient wounds and to protect the wearer against splashes or sprays of bodily fluids. They aren't effective at blocking particles smaller than 100 micrometer. And that's a source from 3M.com that this article referenced. One would need an N95 or greater mask, efficiency mask, to help prevent the virus from going through. But N95s, if anyone's worn one in a hot summer day, are suffocatingly tight. They get sweaty, they get moist, and then it's very hard to breathe. Folks with asthma, it's really difficult. Employers that are requiring them, their employees, are required to have fit tests performed first, sometimes including a medical questionnaire, meeting with a doctor. This is how restrictive of airflow certain respirators are. This is not about slowing the spread of the virus. This is about government controlling the lives of its people instead of serving them. And it is wrong. The government should be putting criminals in fear. But in Maine today, people who are law-abiding citizens, who are going about their normal day, they're going to work, shopping, going to church, going to school, or just assembling peacefully, have to live in fear if they don't bow the knee and wear a mask. The people of Maine have had very few opportunities to say what they think and feel about this control and overreach of their lives. Today, this resolution gives them that opportunity, something that you have not been afforded since March until now, because the legislature has been out of session. And I would like to state clearly, the Maine State Constitution in Article 3, Section 2, if you walk away not thinking of anything else, and as us as commissioners walk away not thinking of anything else, the governor, and more importantly, the legislature, has violated the Maine State Constitution anti-delegation clause in Article 3, Section 2 by giving authority that they are the only ones that have, and passing their Emergency Management Act, which is where Governor Mills stems and cites her powers, quote unquote, to issue all of these executive orders. There is very little limitation whatsoever, no protections from arbitrary rules. People that are, you can have a big box store with a couple hundred people meeting there, but you can't have a group over 100 meeting outside. People are required to wear masks even regardless of the ability to social distance. And the list goes on. The legal doctrine of non-delegation, which is key for us to look at, and it's key for us as commissioners to look at, because if we're requiring people to wear face masks, and we're doing it because the governor is dictating to us, a smaller but still legislative body, our authority and our responsibility as commissioners is now being trampled upon. And we cease to be representative, and we instead become dictative or, frankly, repetitive. The doctrine of this is from a Wikipedia Wikipedia search. The doctrine of non-delegation is the theory that one branch of government must not authorize another entity to exercise the power or function which it is constitutionally authorized to exercise itself. It is explicit or implicit in all written constitutions that impose a strict structural separation of powers. I would add that the Maine State Constitution does that in Article 3, Section 1. The whole goal of this resolution is to bring this question, we as a commission could bring this question before the Maine Supreme Court and ask this to be considered, because this is an area where we actually do have some jurisdiction. We're being asked to require you all to wear masks as a condition for you even being able to get into the door. And as you've seen today, being told to move, and I appreciate everyone being respectful of law enforcement, that is still an infringement of your First Amendment rights and the limiting of gatherings as long as they're peaceful, which everyone was. That is the concern. The governor can make you not even have the chance to be heard at a meeting until you bow the knee. The governor has exceeded, and especially the state legislature has exceeded their constitutional authority, and this must stop, and it must stop now. This resolution points out the lack of science behind cloth masks. But more importantly, you can debate the science. It's very hard, though, to find the opposing science due to censorship by big tech media and by the mainstream media. But the debate about the Constitution is one that stands in federal courts in many ways, and also has been considered by the state Supreme Court by just a group of 4 people at one point they were a committee, not even a commission, raising a concern. I look forward to hearing from our constituents about how the mask mandates, and that's the main focus of this, but obviously that the other executive orders have affected their lives and your freedoms. And I urge the commission to pass this resolution, and I respectfully ask everyone in attendance, though I have no authority, I can plead with you to be polite and respectful, and that everyone would behave in a peaceful manner. Thank you.
Thank you, Chair. I just want everyone to know that counties in the state of Maine have zero power to set laws that govern the citizens. Zero. So this is just another day where we are talking about something that's not in our domain. Our domain is the health and safety of the inmates. Our domain is keeping a government running, which is partly what these COVID protocols are that we have been trying to talk about. And it's to run this government efficiently and having these services done so that people can go to court and that justice can be served. That's really our primary goal. It's not, we have absolutely no power to disallow any executive orders in Androscoggin County. And I think for a lot of us here, we might understand that nuance. But there's a lot of people who are in this community who don't know that. Most people don't know what county government does. That's why I think it's very important for me to tell you we don't have that power. And we can't say, don't wear a mask. That's not in statute for what we have. I think we need to take a bit of a reality check here. It's not, last meeting we had the writer, draw parallels between the civil rights movement and the fight against COVID protocols. And that is just so wrong and so insulting to all the people who have died trying to fight segregationism or slavery, and to connotate or to invoke Martin Luther King in this fight for freedom is just so wrong. So we gotta do a reality check here, because I think if we're talking about freedom, maybe we should ask a black person what freedom is to them, because I don't think it's the same thing as what we're saying in this resolution, what freedom is to us. Wearing a mask to me, I don't feel like my freedom is being infringed. Do I want to wear a mask? Not really. But this freedom is the freedom of speech. And so I would respectfully ask you to listen to what I'm saying too, because I think there's a fundamental misunderstanding here. There are people, scientists, educated people, who are all over the world that have said that masks are effective. No one's saying to wear an ineffective mask, but they are saying to wear a mask. And in it, we talk about, England did some study. Well, listen, they have tremendous pride in their healthcare, in the NIH, and they are recommending wearing a mask, just like mandating, just like almost every government in the world. And so somehow our liberty has been trampled because we gotta put a mask on. I don't know, I don't get it. But then again,
Okay, I'm gonna ask,
I'm almost done.
But I'm just gonna ask them not to comment. We're going to give you, time for public comment, and when you're making your comments, I will require that the commissioners listen attentively and politely, and I'm asking you to do the same, please.
Thank you, Chair. So on this fundamental misunderstanding, a lot of this just isn't true. And we have it in here saying that the governor didn't call the legislature into action or to meet, and at the same time saying that her actions are unconstitutional. Well, let me give you an education. There are 3 independent branches of government, okay? The legislature calls the legislature. The executive branch is the governor. The judicial system is the judicial system. The governor doesn't call the legislature back into session. The legislature calls the legislature back into session. They have been meeting. They have been talking. Just because some people have been shut out doesn't necessarily mean you can't say they haven't done it. They have chose not to meet. They have had meetings, though, the Leadership Council, which are public, they have met. So at the same time, you want to say, she hasn't called us this, and we're not following the Constitution. Well, it's just a fundamental misunderstanding. So I gotta say, it is one thing to say, and I'm not saying that people who don't want to wear masks, that is, I'm not just saying that, like, casting that off as not a valid opinion, okay? But what I am saying is that all this stuff in here is just, it's unfounded. It's unfounded. And so, yeah. So I gotta say, just, we have no power here. And what we should be focusing on is the health and safety of the inmates, this building, facilitating the justice system, registry of deeds, registry of probate. Those are things we need to take in account. And I think that it's a disrespect to all of us and to the Androscoggin County government to, call everyone to have them come about a resolution that has nothing to do with us. Call your legislator. Those are the people who have the decision power, not us. And I think I would encourage everyone to vote against it because it's a dangerous precedent. We don't have the power to change that. And it's unfounded, and let's face it, masks are effective. It's true. It's true.
It's not the legislature.
No, sir. We
you.
will be very respectful of you when you get up and talk. I'm asking the same. Is there any other comment from commissioners before we take public comment? No, let's give everyone a chance to talk. Yes.
Madam Chair, thank you, Madam Chairman. I agree with much of what the Commissioner Madore said, and I've voiced it to some people, letting them know I'm very, very sympathetic to the issue, and agree that there's a abuse of power going on, and but that in effect this county commission does not have any real power to affect laws of that nature. Now, this commission does have the power to be a lobbying tool, and we have exercised that in the past. We passed a resolution earlier this year, which was 6-1 in favor of calling out the governor, saying open up the economy, cut the crap essentially, and so that we knew that we couldn't force anything, but we knew we could affect some lobbying pressure, and there was an easing of the restrictions. Interestingly, I don't know if it had anything to do with that. A couple of days later, and then within a few days, Commissioner Larry had the camping ground people calling and saying that Memorial Day was coming up. They weren't being allowed to open for some bizarre reason, and would we please help? And we didn't know if we could help or not. And after a while, the chair called a meeting. Before the meeting was even held, the governor changed her opinion, as she does so often, and said, yes, you'll be able to open on Memorial Day. So I can't say we don't make any difference here, but the difference that we make, I believe, is as a lobbying tool. Now, the proposal before us essentially appears to take, legal matters into their own hands. I don't think we have the authority to do that. And I also got plenty of emails for the proposal, Commissioner Isaiah Larry's proposal, and also many against. The ones that are against were essentially afraid they would get sick and so on and so forth. You understand that, I'm sure you've heard it. So there's a process going on where I would say people are not fully informed. And I'm interested in figuring out ways to inform people better, because I personally don't believe in sitting here and listening to information from Governor Mills and Dr. Shaw, who thinks he's a celebrity now. I guess he says the same things over and over again, or the CDC, funneling that information automatically. But that doesn't mean we have the power to change it. Now, we may be able to find a way to affect education, get people to start thinking, because that's probably what's needed. Because, you know, if we pass this order today, nothing's gonna change. But I just wanna say I'm very sympathetic to what Commissioner Larry's putting together, and I'm glad he did, and I'm glad people are coming out and getting involved and engaged in what's going on. And from here, who knows what can happen, but it's a tricky matter here. We have other responsibilities of funding that comes in. Funding could be dried up, the taxpayers could get blacked. I mean, it's a very touchy power game, and very uninteresting to follow and learn, but you know, somebody has to do it. So that's why we have Commissioner Ames. So it's tricky. Yeah, we like to do what we can do, but we have to do what also works. So there may be some other strategy that's necessary to get where people want to go. It may be premature to think we're going to force people to decide, to say that you can now not wear a mask, even though that would be my preference. Thank you, Madam Chair.
Would like to address this before we open it up for public comment?
Madam
Okay.
Chair. I would just respectfully point out what is being considered by us as a commission is that we will be requiring the public to wear masks. So we can claim that we are not in authority over here, but we are getting a directive requiring the public to wear masks, whether that is their choice or not, in order and as a condition of being able to enter this building. That also does apply to us as we are commissioners and sworn oath to uphold the Maine State and the federal Constitution. The issue at hand is not so much the masks, though that is the frustrating part about this. The issue at hand is whether the governor's, the Emergency Management Act, the governor cites her power from, is actually legitimate to begin with. And that is the issue, whether it's a Republican, Democrat, Green, or whatever else independent unenrolled governor. This is a concern, and it's something that I have some legal counsel that stated that this is something that we could possibly put forth towards the Maine State Supreme Court. There is precedent for that being held, even though we are not the legislature, we are a legislative body. And if we do not decide this question now, we will be basically part and parcel to whatever the government demands when we reconsider this county policy requiring the public to wear masks.
One last thing, Madam Chair. I would like to add that I don't exactly know what the posture of the different lawsuits. I talked to some people, but they didn't seem to know exactly. And there are some clauses in the state constitution that say there must be a separation of power between the legislative and the executive, which is the governor. And there appears not to be that. And this year, this session, there has not been a vote granting the governor the authority for all-encompassing authority. So her authority right now is invalid as far as I'm concerned, although a court might say differently. And there are previous court rulings that say that you cannot hold a future legislature, you cannot hold a future legislature to the fire. You cannot require them to do certain things, because that's been attempted in the past. That's a law saying the legislature must do this. Well, new legislature that comes in can change that with a majority votes. You cannot do that. Therefore, it would seem to me that the current posture of the legislature as it relates to the governor is invalid. However, the legislature would probably vote with her because they're in the same party. That said, I'd be happy to pursue the possibility of launching a lawsuit spending county money, which we're very hesitant to do, and probably joining in with other counties. I'm guessing, I count probably 14, up to 14, I'm guessing might join in on such a thing. That might be a proper approach to it. I'm still hesitant to vote for this the way it sits. I don't think it'll make a difference, but I'm certainly willing to move forward with some.
Thank you.
Thank you, Chair. You know, on the three branches of government, the legislative branch of government has talked about it and has chosen not to act on it. They've chosen not to. They've chosen to let the governor issue pretty much the same mandates that almost every government in the world has. I mean, honestly, they're not as restrictive as a lot of places in the United States. So I think we can be grateful for that. And the judicial branch has upheld plenty of, or, you know, the substance of the governor's orders. And there have been hundreds of lawsuits in this nation upholding governor's orders. So I don't think there's going to be any way around that. If it continues to be if she continues to say that there's a state of emergency late, you know, after it's, say, not as much of a issue, then yeah, there's a problem. But that's not what's happening. And I think a lawsuit against the executive branch, a second lawsuit against the executive branch, would be a terrible mistake for Anderson County, a tremendous waste of money, because it's been settled. But it'll be over soon. You know, I implore everyone to be patient. It'll all be over soon. This thing likes to talk about, you know, in this, it says tyranny. Like, somehow this mask mandate and the early closure thing is going to lead to what? I don't know, jailing of people who don't wear masks, like, who are anti-government or something. I don't know. This resolution talks about how this mask mandate is a step toward, is going to use for tyranny. And I just gotta laugh at that, because it's a piece of cloth over your mouth. I mean, the government is only as legitimate as we make it, and what is disturbing about that statement, that it's going to be used for tyranny, is that it seems to suggest that there's some sort of conspiracy going on in the executive branch or in governments all across this world. That somehow we're not going to be able to wake up in the morning and talk about how great Ronald Reagan is or something. So I got to say, you know, if we pass this thing and saying that there's going to be tyranny because of a mask mandate is, again, dangerous.
Point of order, Madam Chair, to correct a mistake. These has actually been
No,
considered
I-
by the state
I
budget.
have
This is,
not, you
But I have the
talked
right to
several
point of
times.
order for
I would
correcting.
like to turn this over, and I want to get public comment. They've waited a long time. There will be a time after public comment if commissioners each want to make one final statement. During, what's that? Yes, during a public meeting like this, public is allowed to comment for 3 minutes, and I want to remind commissioners, we're not going to argue with them, we're not going to engage with them. This is their time to give their opinion, and I want to be very careful that we do that. So, do you have a watch? Okay. Is there someone that would like to go first?
What's the time?
3 minutes.
I'll speak.
Certainly.
Should I come up here? or-
Sure, if you would, if you don't mind, you don't have to, but if you don't mind, that would be great. If you would, though, would you say your name?
And where you reside also.
Yep. My name is Will Keniston. I'm from Livermore Falls. I'm here today representing Beacon for Sovereignty. We're a group of patriotic Mainers that want what's best for our families and our state. Who am I to stand up and speak? I'm not a doctor or a politician, but I am a Mainer, a dad, and a friend to several small business owners. I'm no expert, but like many here tonight, I have eyes, ears, and a heart. And you know what they're telling me? They're telling me that something's wrong in our great state. For almost a year now, we've heard that it's just a few more weeks. We've heard that once we flatten the curve, all this will stop, yet it hasn't. The governor would have us believe that not enough people are following the guidelines and and that's why COVID-19 numbers continue to climb. The government and the Mockingbird media want Mainers to blame other Mainers for the prolonging of their suffering. The truth is, those in power are the ones hurting the people of Maine, both by their actions and inaction. In the beginning, it made sense to hunker down since we did not know what was going to happen. We feared the worst, but as time has gone on and data has been collected, it turns out that those fears were unfounded. This is why tens of thousands of scientists and doctors has come out against lockdowns, mandates, and the quarantining of healthy people. We keep hearing that Dr. Shaw is following the science, but what does that say about the 10,233 scientists, the 27,860 medical practitioners that have signed the Great Barrington Declaration? If you're not familiar, I encourage everyone to take the time to look it up. But it concludes that actions being taken by government will have immeasurable consequences on people's mental and physical health for years to come. Are we to disregard over 30,000 professionals with degrees in the medical field? Are they all wrong? Are they all conspiracy theorists not to be trusted? Speaking of science, I'd like to know what science Janet Mills and Dr. Shaw are following. They say that these people are not to be trusted. Yet our own CDC director was fired from his last position at the Illinois Department of Health for his mishandling of an outbreak of Legionnaire's disease. What is his right? Why is he right this time? And why does he apparently have data that qualified professionals do not? My gut tells me that we have to wake up and realize this is not about our safety. We have to come to terms that COVID-19 is just another tool to be used to control us. We have to accept that this is about telling people how to live their lives, what stores to shop at, how to interact with each other, and what to think. Like many of you, I've seen our governor's mandates gut our constitutional rights. Unfortunately, Governor Mills has found a powerful loophole to allow her to circumvent the Constitution. She has figured out that she can use her power over the state licensing board to force business to require masks and enforce social distancing. If that wasn't bad enough, what's next should horrify us all. Governor Mills will soon begin targeting our employers in a way that will force them to require vaccines for their employees. Does that sound crazy? Well, it's not, and soon your employer will be forced through OSHA to require vaccines in the name of safety. This isn't coming, this isn't fear-mongering, it's reality and it's here. If you're thinking that you'll just simply refuse and cling to a medical or religious exemption, don't forget about what happened last March when half the Maine voters decided to take that right from countless families. If we don't stand now and push back, what other rights will we lose in the name of safety? If they do roll back the mandates and the masks come off, it'll only be temporary. I promise you that during the next flu season or sign of a virus, the mandates will return. If people here are still holding out hope that anyone in Augusta, Republican or Democrat, will do something to fix this, you're delusional. Our legislatures have chosen to neglect their duties and have broken Article 3, Section 2 of the Maine Constitution by handing their powers over to Janet Mills. The Democrats don't want to fix it, and the Republicans only cry that they're the minority and powerless to combat her. None of our legislatures are willing to take a stand, so it's going to be up to the town selectmen and the county commissioners to do so. We need you to have the courage that our legislatures do not. There is an abundance of science to be followed, not just what's being offered on Channel 8 and Dr. Shaw. It's time that we Mainers come together, take back our state, our lives, and it's for this and many other reasons that I'm here today asking you to support this resolution. Thank you.
Anyone else like to speak?
Don Dubuck from Minot, Maine.
How do you spell your last name?
Dubuc. If anybody wants a copy of the Maine State Constitution that they've been talking about, you can take a look here. It's exactly what Isaiah has been saying. Going through, so I won't repeat any of that. Going through, kind of concerned about the lies that we're being fed through the media. If you take a look at the paper that was in just the other couple of days ago from the Sun and Journal, the media writes that 590 at the time passed away from COVID. They've said passed away with COVID. Not from, with. That doesn't mean that all those people died with COVID, but it makes it feel like the people are. You're scaring these people. If you take a look, Take a look, even, I think today, it was 610 people that they said passed away with. The difference between passing away with and from is like this. Don Dubuck passed away with an appendix. Don Dubuck passed away from a ruptured appendix. See the difference? So these people, that what they're telling you, how many people, is not true. And then you take a look at what Isaiah was saying about masks. It was kind of funny. I haven't talked to Isaiah about this and stuff, but I did some homework, did a little research, and I found a journal zooming in on molecules, and anybody can take a look at this and see what the size of the molecules are. If anybody work construction, do spray painting, you ought to see the size of the mask that you have to wear. You have to get OSHA approved to wear the mask. A paint molecule is a lot bigger than what the COVID molecule. The mask that you're wearing, the mask that he's wearing that falls down below his nose half the time that he's sitting here, it doesn't work. There's a study in Denmark that they had over 6,000 people study. They say the difference between what the mask people, they had 3,020 people and 2,900 not wearing masks, and the difference was negligible. The masks don't work. These surgical masks do not work, and to have to force people do it. You walk into Shaw's, you take a look at the elderly out there. They're always trying to pull up their mask. You can see they're having a hard time for no reason at all. If you take a look at the 610 people supposedly that's passed away, and it's been a year, it's been since February of last year. Take 610 people divided by 1.3 million people in this state. That's 0.00004% of the population. And we're killing the economy? It's wrong. And to his point, and to Isaiah's point, if Andrew Scoggin starts this, what do you think Oxford's going to say? Hey, I want to join Andrew Scoggin. Lincoln, why the hell are they having to wear masks? Aroostook, there's nothing up there but farms, and they're having to wear that. Come on, you don't think they're going to join? Somebody has to take a stand, and it has to be us.
My name's Lynn Hodgson. I'm the administrator for the Maine Freedom and Liberty Fighters. I'm a pastor. I'm a counselor.
Where do you live in?
Poland. The COVID deaths from January 4th, 20 to January 16th, 21. 296 deaths. Underlying cause COVID. Multiple causes, and they tested with COVID. So they died of the multiple causes, 373. Okay? So January 16th, 19 died with C19, but that same very day, 309 people died of natural death. Now, the worst week, 12/12/20, and we haven't been that high since, was 44 C19 deaths, 330 natural deaths the very same day. On the very same day, 69 heart attacks. Okay? So June 20th, an update page on the updated page on CDC, National CDC, because on the updated page, you look it up, it said that because the virus was not as dangerous as they assumed it would be, they decided to incorporate into it influenza and pneumonia. So anybody who died of influenza and pneumonia automatically went under the COVID stance. 2, masks don't work. Otherwise, those who wore them would not have gotten sick. I believe Dr. Fauci and Shea have no idea what they're talking about. 2 weeks ago, Fauci said, we're going to have to double up or triple up on our masks. Last week, he said, well, there's no proven fact that it will work. Well, if you thought one mask would work, why wouldn't two masks work better? So I don't think he knows what he's talking about. 3 and 4, I'm gonna combine them. Emotional and mental abuse on our elderly. On our elderly. My mother's 92 years old. My mother has lived through every Hong Kong, China, Spanish, whatever flu's gone around. She got kicked out of Martin's because my 92-year-old woman, my mom, wouldn't wear a mask. Now, I don't know about you, but if you knew my mother, she's not very happy about any of this. And some of the people that she's living with in her place have not even come out of their homes. Now, that to me is abuse. If it's not mental abuse, it's physical, emotional abuse. Now, comes a point where we have to stop fear-mongering. And this is when they hear 600, and I'm sorry, correct, 800 people have died, or 618 people on the death. I looked at my husband and I said, that doesn't even match the numbers that I just looked on the CDC site for the state of Maine. So we cause them to fear, which is abuse. Now, medically, how about the elderly that can't wear the masks? What's the matter with we're forcing these elderly people who cannot wear masks? So in a way, we're talking again, abuse. Sexually abused men and women forced to wear masks when they are traumatized and brings back these emotions. If you've never been sexually abused, you have no clue what they're going through, but they have. 7, we talk about aerosol coming from our mouths, but has anybody tested to see what the percentage of oxygen that people are not intaking that's causing them to have headaches and also lightheadedness. So we need to really, if you're going to cover your face, you better start taking some tests and stop saying, 618 when it was only 200 and something that died of, and these work, and they don't. 8, according to the Constitution, it is our right to life, liberty, and the pursuit of happiness. When a people's rights are being violated, and for pursuing happiness, life and liberty are being made by an executive order, it's tyranny. An executive order is to maintain a law already written to protect a people. I'm sorry, but that's what it means. 10, during the 9-10 months, there has been no legislation working together, and if it's their fault, then we should go to them. But also, she should at least advise or call and say, hey, we need to get together. 11, she has made her executive order an illegal law. She's trying to make it a law. And in respect to the establishment of religion by prohibiting churches to have services. Now let's go into the next view here. If I remember correctly, no business or a church or whatever, that if they were not following, they were fined $1,000 or they had to go to jail for a certain period of time. Excessive bail shall not be required, nor excessive fines imposed, nor cruel and unusual punishments inflicting by fining, and she has done this, and it's against the Constitution, $1,000 and up to 180 days in jail. If anyone does not comply with the executive order, which is not a law, that does not maintain the law, this is what happens. The last one, Amendment 4, the right of the people to be secure in their persons against unreasonable searches and seizures. How many licenses have been seized from the businesses that cannot operate because they felt that they should and they were going by the guideline? So yes, I agree with you, sir. And it's a shame that this has to happen. And it's a shame.
If you could help me just watching your time just a little bit, I want you to be able to present everything you prepared, but.
All right, yeah.
Thank you so much.
And if you could just, give your name and where you live, sir?
My name
Disgusta, Maine. I've got mostly questions here, not really much of a statement, but, so if I have extra time left over, if you feel free to answer something, that would be great, you know, and what you already have for beliefs, that would be awesome, just think about it. Okay, why are we destroying our communities and businesses for a cold virus that has a survival rate less than, actually survival rate more than 99%? Why are we causing our children to live in fear? You can see that on their faces and their eyes. It's going to affect their futures and their mental well-being. Why is it that 85% of the people in hospitals wore their masks and they wore them religiously and they're still getting COVID? And why are there no more reports on the news about the flu? You don't see that anymore. And we've never shut the country down for the flu. This doesn't make any sense. And lastly, I ask for the state government and you to follow our constitutional rights that we have. Janet Mills is not doing that, obviously. And as far as wearing masks, it's my body and my choice. So if I want to get sick, that's up to me. That's it.
Thank you, sir. Go right ahead, yes, sir.
Sir, you can state your name and where you live.
Mark Chassie, I live in Auburn, Mayfield Road. Some of the things that you mentioned, sorry, what's your name again?
Commissioner Madore.
Oh, thank you, Commissioner. Maybe they're correct, maybe they're not, but my understanding is that the leadership of the state legislature determined they didn't want to convene the registered legislature. At least that's my understanding. So there may be some confusion on that part, which is why they haven't actually convened them. They may talk about this a little, but it wasn't like official. One of the things this is just something I'll read from quick, and it just goes to show how people who don't take something seriously. The Maine Ethics Commission is set to open an investigation of Governor Janet Mills after several sources confirmed that the governor attended at least 2 relatively large family gatherings over the recent Thanksgiving holiday. The impending investigation into the governor's actions will determine whether or not the governor violated her own executive orders as well as her very own plea to the people of Maine to avoid family gatherings the holiday season. That was for Thanksgiving. She was seen in 2 places, big gathering. And that we've seen that among leaders across the country. One of the other things you may have said that may not apply to Maine, but I know applies to other states, is they have different counties that have put up resolutions. Because these are mandates, not laws, they put up resolutions in their counties that said, no, we're not going to follow the mandate. And they've passed through and they've executed them. Like I said, there's different states. I know California has done it, and I think Ohio has done it. They were actually filed lawsuits and they've won them as well. You can look into that, and again, I don't know if you can do it in Maine, but I know that it's been done throughout different parts of the country, so that should happen. 2 more quick things is that one is we harbor 300 billion viruses in our systems. We are made up of viruses. That's our system, and so you're going to have viruses come around, and some of them, until your bodies adjust, yes, you may be ill, and you're going to have some death, absolutely. But we've had that for eons. People who are at most risk, yes, those people, when they get it, you quarantine them. The other people, they're free. That's how you stay alive. That's how we do in societies. Because what we're doing is by diminishing people's interactions, facial. I mean, I see kids see me walking down the street, and by the way, there's 99% compliance in the different stores and such, so the rates were skyrocketing, means that that's not really working. And these kids are looking at you going, oh my God, there's a smile. So the effects are there, they're going to be here for a long time. And here's the real kind of a funny one is that right now in China, you've probably seen this, right? They're testing and they have a little dummy, and if you're traveling, they want to check with swab up your, rectally for the virus, well, then what does that tell you? It's gonna be here too, probably, and I'm gonna have to wear extra Depends. I mean, I'm already passing gas. I mean, where are we going with this stuff? So anyway, everyone else has talked about the Constitution, everything else, and that's self-evident. But those are a few points I just wanted to make. Thank you.
Good evening, my name is Paul Medor. I live in Lewiston, I've been a lifelong resident of Maine. I'll be brief in my comments. You men are brave, you men and women are very brave to do this. The reason why this is happening today is because the legislative process has been shut down. You no longer have a right to petition your legislature. I've called all my legislators, I've heard from none of them. That's why this is happening here. This is happening because it needs to happen. And when people are denied legislative access, with Samuel Alito in November of 2020 stated in the Federalist Review that the United States of America is under the most restrictive constitutional restraints in the history of our country. In the history. Now, he was criticized sharply, and any conservative is going to be criticized. I see some of you may have that fear that you're perceived as being conservative because you're holding this forum. The legislative process has been shut down. If you go to the Civic Center and petition your legislator, you'll get arrested. If you stay on the grounds and hold a sign, you don't have a right to be there. They've taken the State House and they've moved it to the Civic Center. And you'll get arrested if you don't leave the property. Now you tell me you have a legislative access. You don't. Our rights to petition have been crushed as a result of these authoritarian laws, these authoritarian rule. That's why we're here today. And you men and women are brave to have this hearing because it needs to happen. And at least the public will hear what the sentiments are. Another point I want to make is the way we're treated out in the public. We're anathema. Anybody who doesn't wear a mask in a public area is a third-rate citizen. And it somehow qualifies you that if you want to be respected by others, you have to wear a mask. Identity politics, that's what's ruling the state and the country. So I applaud you for having this, I applaud you for bringing this up. I know it's an inconvenience, but I want to thank you for doing it. I want to register my support for this resolution, and I would pass it, and I would support it unconditionally and categorically. Thank you.
My name is Phoenix Amerston. I live in Lewiston, and I was asked to present some of this information tonight. COVID-19 is basically another flu virus. It exists in the world now. It will never go away. It's going to come around every single year, just like every other flu virus in the world comes around every single year. We need to learn to live with it without shutting down the entire world. We can't shut down everything every time somebody gets a cough and a sniffle. I am not a healthcare practitioner of any stripe, but the information that I'm going to be giving does come from healthcare practitioners. They are doctors from an organization called America's Frontline Doctors. They have a website. Everything I'm going to tell you, they have researched it all. All the information is on their website. Everybody is saying now, well, the vaccines are available, everything's going to get better, just go get the vaccine. Well, let's talk about the vaccine. The masks are bad enough, but the vaccine is probably worse. They have proven that the survival rate for this virus, without any treatment whatsoever, is for people under 20, the survival rate is 99.997%. For people 20 to 49, the survival rate without treatment is 99.98%. For people 50 to 69, without treatment, the survival rate for this virus is 99.5%. For people over 70, without any underlying health conditions like obesity or diabetes, if you're generally healthy, without treatment, the survival rate for this vaccine, for this virus, is 95%. Why do we need a vaccine that is untried and untested for a virus that has such a high survival rate? One of the things they stress is that this needs to be referred to as an experimental biological agent, not a vaccine, because it's still in the investigative stages. It has not been approved by the FDA as a vaccine, and therefore it is not legally and technically a vaccine. Injury from something that is still in the investigative stages, if you decide you want to sign up for this, that's great. There's a very low percentage of people who actually sign up for medical trials. If when you get this vaccine, that's actually what you're doing. You're signing up for a medical trial. They don't necessarily tell you that, but that's what you're doing. You're signing up for a medical trial. Because this is still under investigation. And if you suffer injury from it, it's adjudicated differently than if you would file charges under a vaccine that has actually already been approved. They have several reasons for believing that people should not get this vaccine. One is the mRNA technology. It's brand new, and it's just not a good idea to use technology that's brand new. Another concern is the tremendous failure of previous coronavirus vaccines. Coronaviruses are not new. They've been around a while. The vaccines they've tried to come up with in the past have failed. SARS-CoV-2, which is what this one is 78% identical to SARS-CoV-1, which they did try to come up with vaccines for that in 2005. Those vaccines failed, which is why you never heard about them being brought to market. Some of the known complications does come from a study that was done for the SARS-CoV-1 vaccine. They tested ferrets. It was a 2-dose vaccine. They gave them the first dose, everything was fine. Gave them the second dose, everything was fine. They exposed them to the SARS-CoV-1 virus again. They all died. Whether that will happen to people with this vaccine is unknown. And that's a good reason for not getting it. They also know that it has neurological problems like Bell's palsy as well as others. They list them on the website. You can go check that out. There are also a lot of unknown complications with this vaccine this alleged vaccine, because it is untested. One of the potential issues is that it could cause fertility problems. And because of that, they do not recommend that any woman in her childbearing years take it. Another thing is that concerns them is that Big Pharma is immune from liability. So if you do get this experimental agent that they're calling a vaccine and you suffer from it, you have no recourse. The effectiveness, they have already known that it does not stop transmission. They already know that there's no proof that fewer people die because of having gotten this. They also don't know how long it actually lasts in your body. Now, drugs are for people who are already sick, but vaccines are given to healthy people. Now, if this experimental agent is given to our military and frontline workers first, which is what they're recommending, and they have the same problem that the SARS-CoV-1 vaccine had, where ferrets died after they were exposed to the virus, after they had received the vaccine, don't you think that would maybe affect our national security? Especially without knowing the long-term effects of what this could bring. Another thing is people of color. People of color have had serious issues with vaccines in the past. And because of that, Black people tend to be not too anxious to go rush out and get the new vaccines when they come out. The government is actually pushing this heavily on minority races in spite of that, because they say that this is racial justice. This vaccine, if they go out and get this vaccine, it will give them racial justice. And so it's being pushed on them heavily. Some documents even talk about how different races, it talks about how they are being targeted for their vaccine hesitancy in order to get them maximum vaccine acceptance. So they recommend that Anyone under 20, not yet at all, anyone in their childbearing years, age 20 to 50, it is strongly discouraged. It's also strongly discouraged for anyone 50 to 70 if they're healthy, and discouraged if they're unhealthy. 70 plus, if you are healthy, it's your own risk, you do your own thing. There has been a big fight, as already been mentioned, over possibility of forced vaccines. They do recommend a petition that they have to sign because this is a human rights issue. This is not an employee mandated thing, an employer thing that governments or employees or airlines can force on you in order to allow you to travel. It's a human rights issue. And so there's a petition that they talk about on stopmedicaldiscrimination.org that you can go and sign.
Thank you so much.
My name is Michael Heath, and I'm from Kennebec County. I'll limit my remarks to a minute or less. I want to applaud the commission and especially Commissioner Larry for bringing this up. And I think Commissioner Michael made some good points. It's very important that we be discussing this at every level. I believe my father died from complications related to COVID in February. And he said to me, one of his 2 dying wishes was that I should go back to work. And just before the lockdown was implemented from above, I went to work and worked through the lockdown. My wife was recovering from cancer with chemotherapy. So I'm very personally acquainted with this. I don't support the masks. I think it's overkill. I don't think that that what we have done in response to the threat of coronavirus has been appropriate. I think that especially the economic effects of this have been overwhelming, and all levels of government need to do whatever they can politically to push back against this, push back against the governor, and we all need to get back to work as soon as possible, all Maine people. Thank you.
My name is Pavel Sergeyevich Dekukin. I live in... Call me Paul. Last name Dokukin as Nancy.
Where do you live?
I live in Augusta, but I'm working in moving to Lewiston, so I'm kind of in between. But so I'll try to keep it brief. So as you notice from my name, I'm originally from another country, which is Russia. And I keep in touch with my family and friends there on a daily basis. When I'm telling them about the situation here in Maine, because I travel to Florida and I travel to other states, and they don't believe me. Like, there's no way that kind of stuff happening there. And I take the video camera to the store, and I show them how you can get kicked out. You want to get some food or water, you get kicked out of the store, and they still think that it's all fake. That I paid the money to do that. They truly, because in Russia, you think there'll be stricter, mandates there, but they're not. You can go to the store, you can go on with your own business, and rarely there'll be a fascist cashier that say you gotta kick out, and all you gotta do is go to the next cash register and get your food there. So I'm absolutely appalled, disgusted, even horrified when you say that we're not losing freedoms. We lost a lot of freedoms, and not just freedoms, we lost dignity as well. And one of the things that you said that is just a piece of cloth. And exactly, it's just a piece of cloth. You're not even wearing a mask. It's a piece of cloth. Look, mask. Yeah. I'm wearing a mask right now. And the only gentleman here to cared about disabled people is one right here, because if I was deaf and I was trying to watch this video, I wouldn't understand a single thing. There's nothing to read on, there's no words to read, and obviously they cannot reach your lips because you like to put a piece of cloth on your face that doesn't do absolutely anything to protect you from a virus. Now, I work in a pest control company, and I do have to wear actual mask. It has filters made out of rubber, and I have to be, first of all, I have to be physically fitted for it. They want to make sure that, I don't choke on it, or when I do physical activities, I don't just pass out by wearing it for it. That's very important. That's one of the OSHA requirements. And the other thing is I have to be properly fitted for it so the air doesn't go in and out. So once again, none of you calling me again, maybe wearing a surgery mask, but it's not really gonna protect you from viruses. And that's the thing, you say, there are scientists and conspiracies around the world. Well, there are countries like Belarus and Sweden that did not have a shutdown. Belarus never had shutdown or lockdowns altogether. I know that because I also have friends there. And if you look across the spikes, the cases, whatever deaths you want to look at, the numbers, all around the world, it's exactly the same. And the only spikes you see are in states like New York, where they took a bunch of unhealthy people with COVID and they locked them up with the most vulnerable, with the grandmas, with and then that's why all the people dead. If you look at all the numbers, all the people who dying, again, we got Florida, a state like Florida, where you say, by your theory that masks work, then you will see the state of Florida will be gone, Sweden will be gone, Belarus everybody will be dead because they're not wearing masks, but virus is gonna virus, and we can't freak out each time we have a new virus. Try to keep it short.
I'm Kathleen Zostek from Diggsfield.
How do you spell your last name?
Zostek. I'm here to tell you that the science is not settled on masks or on COVID-19. I said not. It would not ever be settled because it would not be science if it were settled. We hopefully avail ourselves to new information, and I hope that we will continue to do that. I am convinced, though, you mentioned the Great Barrington. I have heard many researchers, epidemiologists, and scientists speak on this issue, and they are very much opposed to the narrative you see in the news and by Fauci. So it is censored, you have to go look for it, but there's another truth out there, and I guess to me it is the truth. But I don't speak about that. I'm not a researcher, I'm not a doctor. I'm here to speak more in common sense and freedom. So it's very curious to me that the flu has disappeared. It's killed thousands of people for years and years, and suddenly this year, it's gone. I wonder why. I drive past Walmart and there's hardly a place to park, and yet friends of mine are not able to work. They're losing their homes. It's criminal. It's really criminal. Viruses will always be with us. Somehow we've managed to live through many more serious ones. Thank God this is a pandemic where over, 95% of the people survived and have really like a cold, like very minimal symptoms. So this is the best pandemic we could probably ever have. Scott Jensen, MD, a former senator from Minnesota and a doctor, has stated that in March 2020, mysteriously, the way they counted deaths was changed. So they were, usually you have a main cause of death and contributing. But if there was anything even presumed to be COVID, not even tested, that was the way that it was coded. And I just read a report from Robert F. Kennedy Jr. where he quoted the CDC November report that said from January 1, 2019 to January 1 through October 17th, 2020, the mental health issues of 12 to 17 years old had a 31% increase in emergency room visits. This is staggering. I fell off a ladder a few months ago, and when I was stitched up, the doctor said to me, in Rumford, it's staggering the amount of people I see with drug abuse, suicide, attempted suicide,
and emotional depression issues. So I think we are not counting the costs. Certainly the most vulnerable need to assess their risk. And if you don't want to go to eat in a restaurant, it is not mandated that you have to. You may stay home and protect yourself. But I think there are no non-essential businesses. And let me just say, and I don't care whether this body has the authority to make any changes. You're human beings. You need to take a stand. Let me just see. I think that's about it for me. But I do say that the other thing is very low cost and very effective treatments are being demonized. And just common vitamins, they found that 80% of the people who have very severe COVID deaths and disease are deficient in vitamin D. It is dirt cheap. That is not being publicized. And somebody has blood on their hands. And I propose it's the pharmaceutical industry who wants to sell us very expensive things. So, thank
My name is Carly Estes, and I'm from South Paris. After hearing what you said earlier, I felt compelled to share a quote from Dr. Martin Luther King Jr. We should never forget that everything Adolf Hitler did in Germany was legal, and everything the Hungarian freedom fighters in Hungary was illegal. That being said, I don't think we the people are going to back down over this issue. We just haven't had a way to move forward with it. There's been no leadership. We haven't had our legislators there. So Commissioner Larry did not call on all the people he knew. I don't know him. I have never met him. We were excited to see that this resolution was being put forward and that we actually have an opportunity to be heard about it. And I think this is a great opportunity for you guys to be the forefront in this fight for our freedoms and to show that this is not okay. And that's it.
Hi, Linda. What's your last name? Linda Serafin, Serafin.
And where do you hail from?
Auburn.
Okay, thank you.
I want to thank Commissioner Larry for bringing this forward. I think there's so many people here tonight, and I realize addressing anything federal is beyond the pale, but I am a Republican, and I believe many conservative people right now are feeling that big tech is taking away our free speech. There's talk of re-educating our children. I mean, there's crazy things going on, and I feel like it is so nice that this is happening locally. And I certainly hope that it catches fire here and that it does spread to other counties in Maine, because it's a point that needs to be made. And if we can't make it federally, we should start making it locally. Thank you.
Hi, my name is Jessica Marking. I'm from Mechanic Falls. Could you repeat my name?
Your last name?
Marking.
Marking, thank you.
Sorry, I don't really talk in front of people much, but but I just really want to address the medical exemption part of this. As someone who can't wear a mask and has been discriminated against repetitively in different stores and doctor's offices, it's very frustrating and difficult to do everyday things. I have a mother with medical issues that I have to go to her appointments with, and I have been forced to stay away from her, and then she's had crisis issues, and nobody was with her because they just left her even though they were told she had to have someone with her, and they refused to let me be with her because I could not put a mask, face it over my face. Shields. I've tried to use shields, and some places won't even let you with a shield. So I just really appeal to you, to your humanity, to at least agree with this so that we can have one step forward. Sorry, I tried to tell myself I wouldn't cry, but I'm an excessively emotional person, especially with competition. The other thing is that the governor has been calling on people to turn people in, to turn establishments in that want to just allow people to breathe or have their own rights, or if they can't wear one and they have a medical condition, they're said you can't do that. You're going to get fined if you try to adhere by the ADA or acknowledge these people's difficulties with breathing. Like, I can't breathe with a mask. But she doesn't care. And these people are being told, if you act like you care, if you let these people in to do their business, you're going to be fined. You're going to get shut down. And that's not okay. And so that's what I just have to say.
I wasn't gonna talk, but I heard the word unfounded. My name is Amelia. I'm from Oxford County. What's your last name on your list? Lacasse, L-A-C-A-S-S. And you're from Oxford County. What I think is unfounded is masking children. I'm a mother of two. I have a 4-year-old who has Asperger's. He's been in occupational therapy since he was 1. 2 weeks ago, his therapist informed us that we had to start masking him. He is a rule follower. That's just part of his constitution. So he manned up and his eyes welled up and he put the mask on because he loves OT, but he was terrified. He got in the car. After I picked him up, he took his mask off and he bawled his eyes out. This is not okay. We need medical exemptions at least. There are children who are suffering the suicide rate in the youth. Look it up and try to sleep tonight. Thank you.
All right. Good evening, Sam Hill. Pleasure to be here. And in fact, I apologize. Usually I'm dressed like this. I was in the hospital today, and I'm actually not supposed to be here. I'm supposed to be in bed rest right now, but
Sam, where are you
found
from?
out. Sam Hill, Livermore. Grew up in Lewiston my whole life in the Blue Devils. And to address what the committee is discussing today, I guess I would first take issue with Commissioner Medora, your comment that you have no power. That kind of struck me pretty dearly. And in fact, I kind of want to come after your seat now because I found that really insulting. In an environment where we depend on our legislatures, we depend on our county, we depend on all of our local officials, our police departments, our ambulance, our medical, our EMS. We depend on all you guys to provide structure for our community, for our children. We're doing our best as parents right now and business leaders to try and navigate this as well. And we're really looking for leadership. That's not the kind of leadership I came here looking for, Mr. Medora, and I apologize for my
What about
comments
the
here.
resolution?
I'm sorry?
take care of it.
You're good. Keep going. Am I out of line?
I want you to go ahead.
I apologize.
I don't want people to interrupt.
Okay, I apologize.
No, there's nothing, it's not you. You're
So
fine.
as to the mask resolution that you folks are discussing in particular, I own a home health care company where our main office is in Turner. We have 450 clients, a little over 450 clients, mentally, physically disabled, elderly, and not a single COVID infection or death in the last, how long has this been, 12 months? Not a single one. I don't know where the 600 or so deaths have come from. I'm kind of questioning everything that's going on right now. But the governor didn't pass down any specific requirements for our industry. We just started masking our employees. It kind of takes a lot of courage to get up here and say this today because I get my paycheck from the state of Maine. and from the VA. And I don't want to become a target, but everybody's becoming a target nowadays. Everybody. And it really takes a lot of courage for all these people to come out here today, and I applaud you all. But I have to say I also work with the Beacon for Sovereignty group. Since February of this past year, to 2020, we've been out at the state capitol trying to protect these exact very freedoms that you folks are discussing here tonight. Which is why it's so important for us all to be here and to speak up and to say our truths. So as a business owner that gets their money from the state of Maine to pay their employees, I'm concerned about the vaccination rollout now. At what point does the governor tell me that I have to ensure that all my employees have a proof of vaccination? And once that happens, I have to get rid of all my employees that refuse to vax. It's as simple as that. That's all it requires to get this vaccination. And the mask is just a step in that direction. I would ask you to take note of a name, Wang Ping, Huang Ping. February 3rd of 2020, Wang Ping answers directly to Xi Jinping of the Chinese Communist Party. February 3rd of 2020, Wang Ping held a conference. He represents all of the New England states and the state of Ohio. I say represents because he's the representative for the Chinese Communist Party for those states. On that date, he held a conference and laid out exactly how the states were going to respond to the coronavirus and COVID-19 epidemic. Look at the video yourself. It's exactly the same plan that Janet Mills has put forward, in which she's trying to enforce on the people now. So if you're looking for a link to the Chinese Communist Party, there it is. We also know that Matt Dunlap has traveled to China. So there is some things there that we're still not quite sure of, and I'll tell you right now, the citizens do support any lawsuit that you do want to take against the governor, against the executive branch. We'll support you and be behind you 100%. We're already just discussing getting an attorney ourselves and crowdfunding it with other citizens of the state of Maine. As of right now, we don't have an attorney representing the citizens, and we rely on our local and county governments to take a stand for us. And so, by considering this policy, you're taking our freedoms away. We feel that it's our freedom to wear a mask or not. Okay. Same with a business. If a business wants to enforce a mask policy, it's their business. It's their freedom, and it's not the responsibility of the governor of the state of Maine or the county government to tell us whether or not we should have to. And I just have one specific personal story of a gentleman that I take care of. He has cerebral palsy, and so he's a landlord in Lewiston. He has one building in Lewiston. He has another building in Turner, and so with his disease, he's wheelchair bound. He has really no mobility. He can only barely move the joystick on his wheelchair. He manages his own finances. He can't go into a bank now. He can't speak over a phone. He has no ability to manage his business anymore. He has to use a third party to do transactions at the bank now. That he has to use a third party for everything now. He has business in this very building. You can't, like someone like that, you can't ask them to have somebody else manage a third party, manage his personal affairs. I have mentally and physically disabled people that go to the clubhouse that they're so scared of these COVID-19 policies of this virus. They're so scared, and that's the only love that they have in their life, is going to see their other mentally and physically disabled friends at these establishments, and we've taken that away from them, and it's just not fair to them. So, thank you.
Hi,
solidarity, and I'm very, very appreciative of all of you for your willingness to hear our concerns tonight.
Yeah, where are you from?
I am from Norway. Yeah, and I am here for one major reason that got me scrambling out of bed after having no sleep because of my concern over this issue. Isaiah said it in one sentence. You know, there is a limit on what we can do to keep people safe, and there's a limit for government bodies, and that's all. There's something to be said for a policy that we all have held in business and in government buildings to, don't ask, don't tell. You gotta drink a coffee, take it down, put it back up. It's actually a pretty positive thing, and especially since universal masking has been mandatory since October 7th. And nobody's gotten too manic about it until October 7th, when Mills brought down the mandate. And even after that, this body and Larry Post didn't see a problem with drinking a cup of coffee in a hallway on his way to his office. You here and sitting at this table, 4 of you didn't see a problem with not wearing a mask while discussing and doing the public's business. That was until the Press Herald elevated that little detail into a headline status by mentioning it in the lead photo. And just like that, now you've been thrust into a debate that was summed up by Isaiah. There are limits to how much you can make people feel safe. And there are limits. It's a discussion that we're having tonight that is long overdue. It hasn't, to my knowledge, been held, and I really am grateful that you are willing to hold it. But I do note that when Madam Chairwoman mentioned the email from our group in the form of a resolution that had been sent to you, it was like any other email. You said, well, that's just an FYI. We don't need to discuss that. That was until Isaiah said, hold on, maybe we should discuss this. Maybe we should. And it desperately needs to take place. From the very beginning, all I wanted to have was a voice. I have a medical exemption, and I went around proudly with it in my pocketbook. I never had to show it. But then Walmart came down hard, and suddenly I showed that medical exemption. It meant nothing. And I faced criminal trespass charges if I persisted, and I didn't want to go through that hassle. Commissioner Isaiah is not trying to bring the house down by asking you to pass this resolution. He simply wants to see a dialogue, some kind of balance in this discussion. Of the sort that during the pre-pandemic, you all would routinely have dialogue about every new policy that affected your staff or the public. And now you have an opportunity here because an issue has arisen because of concerns of some employees, and that's a very reasonable concern. It was, in my opinion, an oversight and that led to the rumor mill getting going on that. And there should have been some kind of notification. That's how rumors start, but you have addressed it. And now you have an opportunity to take it just a little bit further, not with an 18-page policy like some towns and cities have done, but by engaging in civil discourse such as here tonight. And I would hope and pray that this is not the only opportunity we have. Please do not give in to that fear-based illusion that more needs to be done, that we need to go into another office like one of you commissioners mentioned at the January 20th meeting, and
because some people might not be masking and they won't feel safe. The legislature isn't allowing the public in. That is very upsetting to me. I don't know the statistics, I didn't have time to check, but I think you're one of the few places that do. And in that sense, I think wherever you stand on this issue, you're leading something, whether you like it or not. So let's just try to talk to one another instead of screaming at each other and giving each other the finger on the side of the street. You know, from what I read, you know, they got scared, and rumors always fly and accusations always follow, and polarization happens when we don't talk to one another. All I want is a voice. All these people want is a voice. Many of us, if not most of us, feel like we have no other choice than to protest on the side of the street because we're not given a voice in any of the major media publications, and our Facebook groups are getting shut down. And, you know, so we have no voice, and that's what we want. There are, you know, legitimate points to be made on both sides of the issue, and one of the major ones is that there is a huge basis of evidence-based research and study being done to question what Mills has in place for the state. And I would just encourage you to not do what so many other people do and say, like I went and talked to a lady on the street in Freeport the other day, and she said, "Oh, the science is settled. You know, there's no more debate." Well, all I can tell you, I'm not a scientist, but when I put on my mask for more than 5 minutes, I really suffer. I have COPD. I'm not asking as a political thing, although that is definitely part of my motivation. I am asking for you to consider that there are a lot of people, for a lot of reasons, who simply cannot wear masks. So be more accommodating, please. Try to find a way to respect one another, and don't treat us and demonize us as not caring about your health. I masked up. I brought a face shield to this meeting, but it wasn't needed, so I'm not wearing it. But I respect people, and I certainly think it's gone way out of hand when the administrator can't have a sip of his coffee in the hallway. I mean, and that gets to my main point here, common sense. What has happened to it? You know, we're talking anal swabs now. I mean, I honestly don't understand why we can't join our science to our common sense. Maybe we can't prove everything, but maybe we can't do everything to make people safe. People have to take responsibility for their lives and their choices. And I'm just going to close with what he said, because I'm your new fan. You know, what do we mean by direct contact? Are we talking about a handshake? Are we talking about it if they walk 6 feet for each other? If they talk for 10 seconds, 20 seconds? Some municipalities are actually seriously debating these issues. I urge you not to go down this road. Let's give ourselves some credit as being the law-abiding, decent people we are here in Maine. I just got this in the mail today, and it's kind of synchronicity because this is a book written about the early history of our state and how it was settled by people who wanted freedom and liberty and were felt they were being mistreated by taxation and by a government in Massachusetts that didn't give a damn about them. And so they rose up and they tried to run them out on rails. There was no killing or anything. But they dressed up as Indians, and they really put a monkey wrench in it, and gradually over time, they got a voice. And they went down to Massachusetts. And guess what? Henry Knox was booted out of office, and I think that's unfortunate because he did a lot of good for the state, but the people's will not be denied. And you could take a leadership stance right now by echoing the legacy of our state. We are the land of liberty. You know, our motto means, you know, the way life should be, and it's, you know, we have the spirit of independence and character in our blood. And what are we doing leaving that independence and that critical thinking to some nameless bureaucrat and scientist in Washington, D.C.? I don't care if he's on the left, the right, or the center. We are, you know, we're Maine, man. We have a legacy of town meetings and civil discussion, and it's not a one-size-fits-all. The coast can go completely, you know, masked up, and they can even wear biohazard suits for all I care. But the character and the spirit of the people in right where we are now is different than in Freeport or Brunswick or Portland or Scarborough. And from the beginning, I've also been saying this is, why is she locking down this 10 other places when there's no cases yet, you know? It's not a one-size-fits-all, and that's the way it's been treated since the beginning, and that's because we didn't have all the science. 10 months into it, we had the science, we have the basis for a thoughtful and intelligent discussion. So thank you very much.
Thank you.
Madam Chair, I want to ask one question. Who's the fellow that mentioned Great Barrington Declaration? Is he still here? I don't remember who that was.
Probably more than one person. There were a few people through here. Okay, Great Barrington Agreement.
Who's familiar with that?
Well, I just looked it up on my phone, just look up Great Barrington.
It
was a gentleman with the sweatpants.
Okay, but nobody is particularly on top of that?
He's right behind that.
No, it was Will.
Yeah, it was.
Will.
All right.
Okay.
We're all somewhat familiar
Will,
with
this is, yeah.
It's right here. It's right here.
Okay.
Did you want to ask him a question about it?
Ma'am, please state your
Okay.
name and where you're from.
Thank you. Thank you all for considering this resolution.
What's your name and where?
My name is Erin Quintel, and I live in Livermore Falls.
Thank you.
I wake up every morning lately and I think, what the hell happened? I'm 65. I don't recognize the country I was born in anymore. And about a month or so ago, maybe it was before that, when the mask mandate really was it really being enforced. I think that was in November. I'm so grateful to God that I happen to have some work where I don't have to wear a mask, because I cannot wear one. And it has to do with, I know a counselor spoke earlier about trauma that happened to me, and I cannot wear a mask. About around in November, I do work one job where I go in and I see my boss quickly, and I do my cleaning, and I stay out of people's way, and I mostly work alone, thank God. And I said to her, this mask thing was like, I knew I wasn't going to be able to go into a store anymore and be free and pick out my own produce or my own clothing even. And I looked at my boss and I said, my public life is officially over. Imagine that, American citizen, and I have to say that my public life is over? I am now a social outcast. And what the hell? When Janet Mills first started recommending a mask. She clearly stated that the people with disabilities are exempt. And now all of a sudden, I am a social outcast because I have a disability? And Janet Mills is supposedly a champion of people of minorities and immigrants and people of color and this and that, but now I'm shit? Now I'm the one being discriminated against. Now I maybe know what it might have felt like to be a black person in the South in the 50s. Now I feel that way. What the hell happened? What happened to our country? What is going on? I tell myself every day, in the morning, ever since March, when this whole thing happened, not to mention, I'm not even going to the lies. I just want to talk about the Americans with Disabilities Act. Why did we even create that? I can't go into a store. Okay, so Janet Mills says, okay, well, I'll get around that. Let's see, we'll offer curbside service. I'm sorry, but I'm not a lawyer, but that doesn't seem like a reasonable accommodation for my choices. I can't go to a thrift shop. Okay, so I can't go to, so am I supposed to call the lady at the desk and say, I'm looking for a woman's coat. I can't come in and try them on. So could you bring it out to me? I could try it out in the parking lot. And then maybe, if that doesn't fit, then you'll have to go back in. Are the businesses supposed to start doing that now? What? I don't have the freedoms that I used to have now. I don't live in a free country anymore. Now you folks here tonight, you can make one step towards saving those freedoms. And I implore upon you to please, please do it. Thank you.
Fran Zostek, Livermore Falls, Dixfield, and Dixfield. I wanted to say a few things. Number one, I know you say you can't do anything, but we can all speak out and tell people what happened here tonight, and the people gave the good advice and truths that they've learned in their common sense. First, I'd like to just say, the legislators and Janet Mills, I think the legislators turned over their part of their work, and they should be getting the cut and pay, number one. They should be gladly to get, because they turned over all these obligations instead of taking part in it in a big way. Number two, I'm interested in statistics. So coronaviruses, I don't know if you've studied them, but I've been studying health for a long time. They go up like this and they go down. Next year they go up like this and they go down, and then they disappear. So by the time the vaccines are all distributed, you'll be going anyway. So you might as well wait around and you'll see. But all the ones that we've had in the past have always been the same. The statistics are really more mind learning than a lot of the medical things that are coming out. The other thing I thought of was, I think I was outside the box already. That's why I'm always thinking, instead of flattening the curve, I want to round the curve, because if I got a flat tire, I want that round. If I want this, I don't want to flatten thing. I want to make it bigger and round. You know? There's a Dr. Lee Merritt who recently I saw a piece on her. She's been a physician, surgeon for 40 years. She didn't know you could do anything about a virus. And two other people she contacted, other physicians, said they didn't know either. They were always taught. You just have to deal with it, water, aspirin, some other things, but you're stuck with it. She just found out that you can. There's treatments for the cold. I'll just call it a cold. And all you do is the hydroxychloroquine, Curtisin, and if you can't get that, Curtisin, zinc, and vitamin D, just like other people have said already. So, and she said, it really struck me and went right to my heart. She said, if there's a vaccine, if there's a treatment for any kind of disease, you don't need a vaccine. You just don't need one. And this is, like many people have eloquently said earlier, that this vaccine is definitely exploratory. 300 and something people have already died of it. within a few days, and 200 something in America. I mean, it's not big compared to the number of people that got it, but it's something to be considering. And since it is an experimental vaccine, and the animals that someone else mentioned earlier, of ferrets and cats were tested with the vaccine for corona, and they never, first they took the first shot didn't kill them, the second shot didn't kill them, but later when they got the wild virus coming through the air by somebody, they all died, all. So I wouldn't be rushing out to get it. That's number one. And the other thing I thought of for good information about the truth about vaccines and about our health, tune into thehighwire.com. So on every Thursday from 2 to 4, if you want to learn something that isn't about the narrative you see on the regular radio and the medical people that are all together trying to make the bucks, thehighwire.com. He's a journalist, he's a reporter. He brings on epidemiologists, neurologists, everybody all over the world, anybody that will come on. He wants to hear about it. So you'll learn from people that have diverse opinions about it. So I would definitely look into that. And this is a time for us in America to stand up. It's if we don't do anything, nothing will happen. So even if you give a good report about what you think or learn something new, and I wouldn't be wearing those masks alone. I don't think we're good to. Thank you.
I'm Jennifer Bissett from Minot, Maine. The reason I'm here is for my children. I have a 16-year-old son who suffers from cystic acne. And the worst thing ever, I almost thought that maybe masks would make him feel better about himself, but what we're seeing is his acne is actually getting worse. These masks are rubbing up against his face. It is the most uncomfortable, annoying, and most discouraging thing I have ever dealt with. Not only for the fact that I cannot help him on a daily basis, but now we're resorting to an oral pill that is no longer working. So then I have him going in high school dealing with that. I have my middle son who we have been doing amazing with his asthma. We have lowered his dose. It has been going well until these masks. I am watching my son. He came in today from snowshoeing and couldn't even stay out as long as his siblings because he needed to take a break. He was huffing and puffing. He is already on the highest dose of Advair, that it was higher than my husband's dose. So not only do we have to sit there and weigh the risks of putting all these extra drugs in there, but the fact is he's not allowed to breathe. He's not allowed to go to the stores with us because he gets winded, because he gets hot, because he can no longer function in a place that, was kind of a good family bonding time as we go to the store. My daughter is in middle school, and she is just a joy. But what happened is she got separated from all of her friends in her school, and so I told her to make new friends. Do you know how hard it is for a young girl to make friends in middle school when she can't communicate, she cannot see their faces, she cannot just bond with these girls, and she can't talk to her teachers about it. My children also suffer from dyslexia, which means we watch people's mouths as we learn and as we hear and as we process information. So not only did they go from advocating for themselves, but they've now remained silent, afraid to communicate with their teachers. And as you know, with a dyslexic, it makes reading and writing very difficult. So the only way they can get in contact with their teachers is by sending a very horrible written email trying to explain why they are not learning in their school and why they could not ask their teachers for help while they were there. I deal with a lot of teens in our community that are suffering from being stuck at home, not being able to go out, not being able to see smiling faces. The one thing I pride myself with my children is that they love to smile. Not only have I not been able to see their smiles, but other people have not been either. In fact, they've been greeted with angry pull up your masks, and they've been actually being groomed to be a little bit more moody and a little bit more disrespectful. And as you know, if you raise disrespected, well, you know, I'm dyslexic, children, that is a generation growing up to spread that. We are in a very dangerous situation. For our children's sake, as a mother who is trying to comfort her kids, I can't even make it through the store. I am hot, I am winded, I am grumpy. So how am I supposed to raise my kids in a joyous atmosphere when I have lost my joy because I can't go to the grocery store and communicate with them and see their mouths and just enjoy being together because I have to keep them at home, especially my asthmatic son. We have this opportunity to change things, to do the right thing, to think of others before ourselves, and we need to do something. It's very important. Thank you.
Hi, my name is Rochelle Sevier, and I live in Livermore Falls. And I'd like to speak out against the medical exemption. I have several medical conditions that makes me not be able to wear a mask. And you know, I at first it was a medical exemption. I was able to go in stores with no problem. But I know in December all that changed when Governor Mills removed the medical exemptions from her mandate. And that is not fair to people who have medical conditions. I have asthma and I have anxiety. I just came out of a relationship from somebody who was domestically abusing me. They're in prison for hurting me. And this person, my ex-husband, used to put his hand on my face to try to scare me. So I cannot wear a mask because of that. And also because of my asthma. So I should not be punished and not be allowed to go into a store or a bank because I have a medical condition and I can't wear a mask. So, you know, if anything, that the medical exemption has to be brought back because there are so many people that cannot wear a mask, and it's going to put people in harm's way because the mask is going to do more harm to people that cannot wear it. I have to use my inhaler, so I can't go in a store because I have to use my inhaler. And if also, you know, I have panic attacks. I have tried to wear a mask, and I have severe panic attacks from that. So it is not fair for someone like me who is healthy. Otherwise, I'm not healthy. I'm healthy in the sense that I don't have a virus, but you know, I have asthma and I have anxiety, and as I said, I'm a victim of domestic abuse. So take all those in consideration and think about the people that are suffering with these medical conditions. And that's all I have to say. Thank you.
Hi, my name is Rose Lacasse, and Lacasse, and I'm from Harrison, and I grew up in Lewiston my whole life. I want to thank you for doing this. This has been a place for me to come and say my piece or just say, you know, I've been stopped on every media. Our rights are being taken away, left and right. And the fact that you guys had the courage to have a meeting and a place for us to come is spectacular, and I am so grateful. I am getting kicked out of every store because I wear a mask that they don't approve of. That was 3 last week and 1 this week, and I have to shop for my people. Otherwise, I don't wear a mask, and I'm the type of person, I'm a free person. I'm a free, you know, I don't have a disease that tells me I can't wear a mask. I just want to live in America where it's free. And that's all I really need to say. And I just thank you again for doing this. There's not a lot of, you guys have more power then you know. You are our local government. Every county needs to be doing this. I applaud you. Thank you.
Hi, my name is Audrey Murphy, I'm from Auburn, and I would like to thank you so much for presenting this. It's an awesome thing to be able to stand up and show exactly where we stand. I'm here to say I'm against the mask mandate. If you want to wear one, that's fine, but as it's been mentioned before, so I don't want to rehash everything, it doesn't work. I have from the CDC website that from, they're saying over almost 74.2% of people that have had COVID have always worn a mask. So masks work, right? I have a healthy immune system, and my immune system is what's keeping me healthy. I've had COVID. It's not something to shut the economy down for. It's nothing to stop businesses from operating. My sister had COVID very badly, the first of it last year, for 3 weeks in Massachusetts. Her adult son and her husband was in close proximity with her, never caught COVID. So, and they didn't wear masks around her, I have to say that. When I was a kid, we ate mud pies. We have germs. Germs are everywhere. We're gonna have germs. But wearing something on your face, you say it's only a mask, that's how the brown shirt started. That's how it started with Hitler. It's been proven these masks do not work. And I applaud you for standing up and taking a stance. Whether or not you can do anything, it shows the public where we stand and how we feel about this. If you don't have any hands to do anything with, at least you're making a statement. You're making a stance. The depression has been mentioned before. Suicide with the children. I am a grandmother of 9, almost 10. Fortunately, all but 2 of my grandchildren are able to be homeschooled. And my 14-year-old grandson is struggling. He used to be a very smart AB student. He's barely passing in some things. This remote thing that's going on with the children, it's not working. Nevada is opening their schools because of all the suicides that's going on. And you want to say it's not political, it's Democrat, it's Republican. It is political. All of a sudden, we have a new person sitting in the White House. We don't see COVID cases tipping across the bottom of the screens anymore. We have governors and a person sitting in the White House that tells you to put a mask on, but they don't do their own mandates. Oh, it's a celebration, it's okay. And having to go into a restaurant, wearing a mask, and then sitting down. So COVID doesn't get you when you're sitting down, but it gets you when you're standing up. I mean, the sense of this is making, it just doesn't make sense to me, and I don't think it makes sense to most of the people in this room. So I know we're running out of time here, but I just want to say thank you so much for bringing this forward. Let's use some common sense. If you want to wear a mask, fine. Wear one. The vulnerable should. Quarantines are for people that are sick, not healthy people. We need to stand up. We need to stand up to the governor. We need to stand up. I don't care where you're at as far as Democrat or Republican, but when you're telling us that we cannot go to church or we can only have 25%, we have freedoms. I want to know, how many are veterans in this room? Thank you so much for your service. Do we have anybody that's a veteran on our cast? No. Well, my brother served in Afghanistan. My brother also served in Kosovo. He went to Panama. My ex-husband served in Vietnam. My father, Korea. My grandfather, World War I. They did not fight and died so we could have our freedoms taken away. And I feel what you're doing, thank you so much. If you can't do anything, just make a stand and for our citizens. Thank you.
My name is Noella Potvin, and I'm from Lewiston. and I'm just a little person in this world. I have just a regular job. I just wanted to share my experiences at Cumberland Farms. When the inconsistencies that I see and lack of common sense. So Janet Mills closed down closed down the state. I was not allowed to go hiking. I'm an avid hiker. I love hiking. That is who I am. That's what drives me. But I was not allowed to go hiking. The trails were closed down. But people were allowed to come into my store and buy cigarettes, alcohol, at my expense. And I'm selfish because I don't want to wear a mask, but you're coming in and buying these non-essential stuff. And I can't go on a healthy hike. I just think I think a lot of this is about money. So we sell masks. What do they say? Fashion mask. And it was so sad to see one of them today said, no hugs, no kisses on that fashion mask. That really upset me. I think they're making money off of these masks. I think a lot of this is all about money. The pharmaceutical, and it really upsets me. I have experienced the lightheadedness. I am also a sexual abuse survivor. I have anxiety. I had a customer come in today, and he had 2 masks on. Well, I was so proud of him that he took it upon himself to take care of himself and not make it my responsibility. I am healthy, I take vitamins, I eat right, I don't take any shots. I don't take the flu shot, I don't take anything. I'm 60 years old, and I have survived with my health. I believe I've had COVID. I didn't go test it, I can't prove it. And I am fine. I went to work every day. I was extremely tired. I had a lot of cramps in my stomach, but I went to work every day. I have worked every day through this pandemic, never complaining, doing what I'm supposed to do. And I'm a veteran, and I don't want my rights taken away. I hate wearing a mask. I feel like I'm being stifled. And that's it. Thank you. Nobody else is in here.
Madam Chair, I forgot, I made copies for everyone because
Oh, thank you.
I don't want to be an FYI.
Thank you.
I didn't come here to expect to give a speech or anything, but I'm not a mask wearer.
Sir, what's your name and where are you from?
Richard Poulin, I'm from Sabattis, Maine. A lot of things, these statements people made, I believe in an awful lot of it, especially in the medical field. I'm not in the medical field, I'm a retired man, I've got children, grandchildren, great-grandchildren, and I see the damage that it does. And the biggest damage of all is the emotional effects. You see grandmothers that can't see their children only at certain times, and so on and so forth, and creating hardship, emotional feeling. And it's more than that. It affects an awful lot of people, and I see it out and about. You go in public places and you walk in or you're close to someone, and they, even if they have masks, they shy away and they pull away from you and so forth. We all know the story. But my concern is I don't believe in the mask. I don't believe it works. I put it on tonight for your benefit. There's a lady that was here and she left, and she gave me not a very good look when she left, and maybe it wasn't intentional, but that's how I felt. So I put the mask on. I didn't want to offend any of you. I thank you all for being here and for listening to us. And I just feel that from an older guy and observing a lot of what's been going on, I believe it truly is political. Those are my feelings. Totally political. And what I do is I try to observe people, what they say and what they do. And we have a highly corrupt government in Washington DC on both sides. And I don't believe anything they tell me because they're a bunch of liars. And I'm not afraid, I tell them at their faces. It's the way that I feel. I think this is really a plan to suppress the American people and to teach us a lesson or to take over. It sounds like whatever you want to call it, you know, but I believe that they're really out to get the American people. We're too prosperous, or have been. They don't like that because we're too independent. And they do anything they can to suppress us. And I believe this is what's happening. I'm sharing what I feel. Take it or leave it, but it's what I feel. And what you had said earlier, that you have no power, you do. Number one, we're all talking, we're all giving our opinions, and you all have a voice. That's power. It's not in your agenda, it's not your job, but you can voice to Augusta or wherever it may be what you feel and what you hear from the people here. And I suggest do a lot of soul searching on yourselves and do the right thing. And that's all I've got to say. Thank you.
I want to thank you for the time and the preparation you put into your statement. I think one recurring theme that we heard was that you were happy that you finally had a voice, and I hope that you'll always find in this room a place where you'll have a voice. And I appreciate you coming, I appreciate your comments. Really, we put a lot of time and preparation into that, and thank you.
We all do.
I appreciate you.
Yes, you put a lot of time into.
Okay, so, you weren't very good at staying in your time frame. I'm just checking.
I came in late, so I don't know what the time frame was.
All right. But you spoke with such passion, I had a hard time cutting you off, so.
Another good sign.
Okay, let's, get back to the motion. We can take a moment and I guess commissioners, if they have, a, final comment they want to make, we could entertain that and then, we need to decide how we're gonna go forward here.
Thank you.
Yes, sir.
Thought this was a good meeting. We did hear about people's passion and people were very well informed. And I agree with everything that was said. We still have this problem of, as Commissioner McGill points out, that we don't technically have any power. Although I like what Richard said, that yes, we do have power, we have the power of influence. We've actually used that a couple times this year, and we think to some effect. The meat of Commissioner Larry's resolution says that we, the Scranton County Commission, we hereby resolve now that all citizens, businesses, and visitors in Scranton County are free to wear or not wear masks or other similar devices. It's a piece of their symbol for similar reasons. It dictates some preference. So, if we pass that, people are gonna wander around and gonna say, well, we have a right to not wear a mask now, we don't have to look at other things. The county commission says we don't have to do that. And that'll open up all sorts of problems, I think. It may open up problems with funding to the county, if we're out of compliance, if we're taking on the budget directly and saying, no, we are fines. People could come back and sue us because they got in trouble or arrested because they wore masks, and these rights that we had designated them legally from this party, instead of come to the authority to designate those rights to people. And I also got emails on both sides of the issue, and it seems to me what is missing the most is that people are not educated. They've been led to believe by this whole COVID system. It started off, and some people have mentioned, telling us how, 5 out of 5% of the people are gonna die when they catch this COVID, maybe as high as 10%, scaring the heck out of everybody. And so even though the numbers became much less obvious, it's like 1/5% may die, as opposed to like many times less, 50 times less or something. By then, the fear had been instilled in people at the subconscious level, and you don't think rationally when emotionally you're afraid. So that's where we are. And I had sent out, interestingly, a couple weeks ago before we knew that this resolution was coming in, a copy of the Great Barrington Declarations, which the people had mentioned and other people that we talked to knew about that. And it's a wonderful piece of work that 3 epidemiologists from very different backgrounds, from different political backgrounds, all got together in Great Barrington, Massachusetts, New England in fact, and they came up with this proposal based on common sense, saying, here's what we need to do. And they signed it effectively, I think, in November. And since then, I've got the numbers. Since then, roughly 60,000 medical professionals, medical researchers, and all sorts of people around the world have signed on to this, saying, yes, this is an approach we should use. Now, nobody knows about that. The press doesn't care.
A reporter asked Governor Mills about that, and she said, well, that declaration has been debunked.
Oh, debunked, yeah.
That was, she's on record as saying that,
Yeah,
yes.
I didn't see the debunking or the data on that. So, I think we should, and that's, if there was 60 professional physicians and such that signed that thing, I'd be impressed with it. Or 600, or 6,000 would be outrageous. 60,000 people, this isn't something you brush into the table and saying, oh, that's fake news or something, yes, and I'm so tired of hearing about it. This is valid, common sense approach, and nobody knows a damn thing about it. And Dr. Shaw has never mentioned this, and the people that are sitting there knee-jerkedly, kiss-buttedly, doing what the governor says to do, they haven't ever mentioned it, nobody talks about it. In a free society, I don't understand. I just don't understand how we got here. So I put a resolution together, I showed it to a few people, and it takes part of the Great Barrington Declaration, and takes some of Isaiah's whereases, and I'm going to propose this as an amendment to vote on instead of the original amendment, because I think this can pass, and it does not do any damage that I can see. I do think it moves things forward. And then I think we should talk with other county commissioners and such to see what we can do to create other additional agreement, and most importantly, other education. And I'll just read you a little bit of it. Some people don't have a copy of it. We just send them down this way, I think we should have one. Anyone has one? And I'll quickly read through some of the points. Go through some of the whereases. You have one? So the meat is where it says, be resolved, we, the Androscoggin County Commission, hereby demand that any and all scientific research be considered by the state of Maine in its COVID response, and not merely CDC guidelines that may be political. And that the following provisions immediately be put into effect with the goal of minimizing mortality and social harm until we reach herd immunity. 1. The elderly affirmed should be protected as a priority through the use of focused protection. For example, nursing homes should use staff with acquired immunity and perform frequent testing of other staff and all visitors. Staff rotation should be minimized. Retired people living at home should have groceries and other essentials delivered to their home when possible. They should meet family members outside rather than inside. 2. Simple hygiene measures such as hand washing and staying at home when sick should be practiced by everyone to reduce the herd immunity threshold. Schools and universities should be open for in-person teaching. Extracurricular activities such as sports should be resumed. Young, low-risk adults should work normally rather than from home. Restaurants and other businesses should be open. Arts, music, sports, and other cultural activities should resume. People who are more at risk may participate if they wish, while society as a whole benefits and enjoys the protection conferred upon the vulnerable by those who have built up herd immunity by being exposed to those who are less vulnerable. Just a couple more things. The Commission recommends citizens stay apprised of all credible research regarding COVID and not just partisan sources or sources making windfall profits from the continuing COVID emergency. Citizens should follow their conscience and common sense regarding lockdown procedures. And a copy of this resolve should be sent to the legislature, each municipality in Androscoggin County and each clerk of each county administrator, along with a copy of the Great Barrington Declaration. I think that forwards a very, very powerful document that has been neglected and announces by the power that we do have in this commission to say, we're putting our agreement behind this kind of alternative research, which has already been done for us. Thousands and thousands and thousands and thousands of medical professionals are backing this up. It's getting absolutely no play. Meanwhile, we're there trying to convince our scared to death friends that they should listen to us when they haven't educated, they haven't vetted the issue, they don't really know what's going on, and they're just frightened to death. So I'm gonna propose this, and not because I don't appreciate everything Isaiah has done, I do, not because I don't agree with everything, I just don't agree with the last declaration where we go and overstep our bounds saying, you don't have to wear a mask, we don't have that right. I think this would be a more responsible approach. And we may have 4 or more votes to do this. So that's, I'm proposing this amendment to place the original. Everybody get a copy?
Quick question, are you proposing that we act on this tonight, or could we have a couple weeks?
I'm perfectly happy with taking a couple weeks and having more dialogue with people, so on and so forth. Depends on what the urgency is felt by the regional sponsor. I think this is a good idea. It doesn't need to be acted upon now. I'm not sure how Commissioner Ames and others feel about it. But I think we can make some difference here, just like we made a difference with the camping group. If we do it strategically and wisely and soundly, then everything can move forward and expand from here.
Madam Chair.
Yes.
Since those references, the opioids. This resolution is not about Commissioner Isaiah Larry. This is not about, even to some degree respectfully, Androscoggin County. This is about the principles of constitutional government. We can argue one way or the other about the science behind it. I would suggest that the Greater Barrington Declaration, while I agree with that approach, is already likely being heavily censored. People are having a very hard time getting their information one way or the other. The legislature, even if they chose not to address the overreach that they authorized the governor with, does not address the core issue, which is that Article 3, Section 2 does not give the legislature the authority to give the broad sweeping powers that she has been exercising from March till now. There are no checks and balances, and as a result, that law is unconstitutional. And if you want to end the lockdown, you don't want to have to come back for another meeting where she may send her state troopers to guard the door and not allow anyone in. You need to have this resolution passed now. It's not about me. It's about Androscoggin County, it's about freedom, and it's about limited constitutional government. You and I, myself included, have not had the opportunity to be able to go to a hearing to the legislature about this overreach. So we either pass this now, and I would have been more than happy to have some other commissioner put forth this resolution and not have my name on it, so they would have a better chance of passing. That's not the issue. I would urge the commission to pass this now. The reason why is that looking at, basically, there's a question, okay, do we have the authority? Look at sanctuary counties and sanctuary cities. Many of these exist, even though that is in contradiction to federal law. And on the state level, let me quote from a lawyer that I consulted. Although that right belongs to the Maine House and Senate, and this speaking of the non-delegation doctrine, the SJC has previously, Supreme quote unquote judicial court, has previously answered questions raised by other committees numbered as few as 4 as it did in 1880 when Maine's elections hung in the balance. So it's important for us, we don't have a lot of power, but if we push this forward, the question then could be put as an important question to the Supreme Judicial Court to get this checked. If we think that the legislature is going to counter their own governor, we are cooked. The root cause is this is unconstitutional, and it's unconstitutional because of Article 3, Section 2, the non-delegation clause in our state constitution. So we need to stand, and this is the way that we peacefully push the issue. Governor Mills will be forced to either call us on the carpet or she's gonna have to back down. And if this goes to court, I have good confidence that this has precedent because Governor Whitmer in Michigan had some of the same powers given to her, and they had the same, almost word for word, Article 3, Section 2 of the Michigan Constitution shot what her actions were down. She played a quick game and ran around and had her DHHS and others go and add that as well. But that is getting challenged as well. If you want the lockdown to end, we need to vote for this resolution and we need to approve it as written and let the governor decide what jurisdiction she has because she has overstepped her bounds and more importantly, the legislature has overstepped her bounds. And this act that gives her these broad powers that could ban any of you from being here, that could throw you in jail, et cetera, this act could be used at any time so that the next meeting we try to have ain't happening. So we need to pass it now, and I respectfully
This is our chance right now.
I respectfully ask the commission to pass this resolution as written. Thank you.
Commissioner Kelly,
I would first of all like to thank each and every one of you for coming tonight, sharing your passion, your experiences, and your thoughts with us on this issue. It's very important, and I can't begin to put into words what it means to me and to each and every one of us to have you here. So thank you. I know that we currently have a motion on the floor, but I would like to move to table this issue to give us an opportunity to digest both documents, to consider all the words that we've heard this evening, and to make the correct decision accordingly. So
Moving that
I
to-
move to table.
Are you moving that, or you're talking about, you'd like to table it, have someone table?
I would like to table.
Because the debate is cut off when you do that.
Correct.
We've only just begun.
Table.
okay. Okay, we have a motion and a second. And, I guess there's no more discussion after that, so we can move directly to a vote.
Sure. If Commissioner Ames has any thoughts.
I'm not gonna vote to table. I'd like to have the vote tonight.
Okay.
I will vote.
I'm gonna vote not to table it. Table it. Vote for it.
I will not be voting to table. This needs to be dealt with now. Governor Mills has had 9 months. We have had 0 months to speak up.
Vote to table. Yes.
And I am going to vote to table it, see how these need to be vetted, we need to know how it's going to affect our interfacing agencies, which we've been working with this week. And so we need to have all that information, to know how it's gonna affect.
Public discussion is.
A special meeting perhaps?
2 weeks.
This is an emergency, our house is on fire.
So we have. Okay. Discussion items.
Madam Chair, there's been no vote to table.
Oh, I went around and took a vote. You want to take a second
That
vote?
was a roll call vote. That did not seem to come across the board. I thought that was a poll.
Okay, I'm happy to go
I
back.
respectfully
All
request a
those-
roll call vote.
That's what I just did, a roll call.
Oh, roll call.
It was.
But I'm happy to do it again.
Madam Chair, can I tell how it went?
Well, let's, no, we
Just
can,
do
I'm
a
happy
vote.
to
Just
do
that-
it.
I'll tell you what the roll call was.
All those in favor? Opposed?
Cowards. All of you that voted for this table. A bunch of cowards. Shame on you.
Discussion item?
We're almost a year into this, you cowards. You're gonna put this off.
There you go, Isaiah, there's your folks. There's your folks, Isaiah.
It's your new boss.
That's good, stop.
Folks, please,
Discussion item?
please,
Yeah.
I understand your concern, please.
Shame.
Discussion items?
It's not the end.
What's the date?
So
It's
it's,
not the end.
you're gonna have a vote, same time, same place?
Discussion items?
Madam Chair.
Is this on to discussion items?
You mentioned discussion items.
Okay, yes, go ahead.
Point of order. Public hearing possible on on resolutions? Because this is not a formal public hearing.
Why not?
Just a question.
So will we be allowed back?
Yeah.
The
Right,
17th
right, and
to see this vote?
Without mask, Madam Chair.
You're always allowed back.
Without
What was
mask.
your discussion item? We,
I would just respectfully remind those attending, I apologize for being focused on this motion, but thank you all for coming, whether you're for or against it. Thank you for exercising the right to free speech. I appreciate from the bottom of my heart, you taking hours of your own time, risking life, liberty, and property to show up here. And I appreciate you all being peaceful. I would respectfully ask, even if you disagree strongly with anyone here, please treat them with respect. Do not be violent, do not harass anybody, please treat them with respect. But hold them accountable at the ballot box, and you can look at the charter and you can actually recall commissioners.
I'm running for a chair.
Thank you.
I'm running for a chair.
Yeah!
Let me take this seat.
And we really appreciate everything you have done to stand up for us. We really appreciate you.
Getting you on the 17th.
Second.
Could I get an answer on the public hearing question? I hope to hear an answer to that.
when is
You would have enough time to schedule one, I would believe.
Well,
You had that thing so tight I couldn't
It
move it when I
wasn't a
first
formal
got up.
public hearing.
Oh, no kidding.
Pardon?